Good afternoon. I now call the Rocklin Unified School District Board of Education Special Meeting Board Study Session for Tuesday, July 27, 2021 to order. Brenda, will you please call the roll?
Julie Hupp. Here. Rick Miller. Here. Rochelle Price. Here. Tiffany Sathoff. Here. Derek Counter.
Here. All right. Prior to adjourning to the closed session, are there any public comments on closed session items? So just FYI, I'd like to review we're going to provide public comment for the board study session agenda item 6.1, which is the CDPH guidance and all that stuff, in about an hour. So we're going to take comments at that. So if there's anything not related to that, if you want to make a comment now, open up. All right. Seeing none, the board will now adjourn to a closed session regarding items listed on the agenda. What we're going to do, folks, just that you haven't been around here, we're going to go into that room for about an hour and talk about some other topics, and then we'll come back at about 3:30-ish, and we'll start this up, and then that's when I think most of you guys would be interested in speaking. So, yeah. So yeah, we're going back there. It's legal stuff, lawyer stuff, so not this fun stuff. Anyway, all right. Thank you very much. The meeting is now reconvened to open session. The board previously met in closed session. No action was taken by the board in closed session. Please stand for the Pledge of Allegiance. The board will now move to study session portion of the meeting. The board will hear from staff and will review and discuss the current CDPH guidance. Following the board study session discussion, the board will open up the meeting to any public comment on this agenda item. And then, so just real quick, guys, before we go off to it, we're gonna have a great conversation about the guidance and talk through different perspectives. We will do a lot of looking for clarification, ask a handful of things. Once we've gone through all the different, what did I say, chapters, elements? Well, yeah, once we go through that, I'll open it up for public comment. We'll roll through, and then we'll come back and we'll finalize all those pieces. Again, we are not making any board decisions, we're not taking any action. We're just here taking a look at all these different perspectives, narrowing things down to what makes sense, what doesn't, how it works, how does it all interact, how does it work for Rocklin kids and Rocklin families. And then I believe the final proposals, process, et cetera, that will be presented and assembled together for the August 4th meeting. So just giving you guys a heads up. So you'll hear a lot of conversation, discussion. Please be respectful. These guys have been working on a lot of different stuff. We'll ask a handful of different questions. Once that's all done and squared away, we'll open it up for public comment. So just so everyone knows, understands. All right. Without further ado.
President Counter and trustees, I first want to thank you for taking time, as you've done throughout the pandemic in your busy schedules, to prioritize your work as trustees governing our school district. Today's study session, which is designed to give the board a chance to discuss the updated July 12th California Department of Public Health guidance and how it could be implemented in the Rocklin Unified School District as we start the year on August 11th. I do want to share that I am very thankful and proud that under our board's leadership and through the determined and collaborative work of all of our RUSD employees, we were able to have our students on campus all but for 17 days last year and ended our school year with all students full-time on our campuses, which is how we will begin this current school year. Thankfully, the new updated CDPH guidance contains much less guidance and mandates than we had a year ago and ended the last school year with. However, we do know that everything is fluid, guidance is constantly changing, mandates are constantly changing, and the information we share today is what we know as of today. And as things evolve, as we have throughout the pandemic, we will evolve our information provided to the board. Gone, for example, in this new guidance are mandates on social distancing. And students, as they return to schools, are much more like our pre-pandemic schools. For example, in elementary schools, students can have normal recess, which my 6th grade daughter loves. We also can hold assemblies, go on field trips. At our secondary schools, we can have events and activities that we couldn't hold last year, like a welcome back rally, or to allow all our students to attend athletic events and not have to climb hills outside of stadiums. Staff and I have prepared a draft working document that we will be using to assist us in the study session. It will be projected on the screen as you have, and you have copies in front of you. Staff will introduce a section and then pause for any clarification and then move to the next section for the board. And again, appreciate the board's sincere diligence in scheduling time to have a study session. So with that, I'll turn it over to Dr. McDonald to begin the presentation.
Thank you, Superintendent Stock. Good afternoon, Board of Trustees. Welcome back, everyone. Here we go again. Good to see everyone's faces. I could have sworn we wouldn't be talking about all this again, but here we are. It just continues. So as Superintendent Stock pointed out, the good news is this document that was put out on July 12th by California Department of Health is much, much thinner than the, I think, stack here I had at the end of my year, on my desk at the end of last year. So it's a good thing we're making progress. We will go through this section by section. What you have in front of you is a table with 2 columns. The left column is actually right out of the guidance. So what it is relevant sections that talk about things like mask or face covering or physical distancing in the school setting. And the right-hand column is our proposal for how we would implement that protocol or procedure for this coming school year. And we'll go box by box. Mr. Flowers and I are going to take turns sharing, and then feel free, as always, to jump in at any time with questions. So first section is easy, and Superintendent Stock mentioned it already. The guidance states that masks are optional for all K-12 school settings outdoors. So we intend to follow this guidance. Masks are optional outdoors for all, in RUSD, all K-12 school settings. This includes passing periods, lunch, recess, PE assemblies, other outdoor ingress, egress, other outdoor school-based activities. So masks would not be required in those settings.
Does that include sports?
Fortunately, there's no updated guidance on sports, and any of the guidance from last year is referred to as a historical. However, we are expecting updated athletic guidance, and we will touch base on that here in this document.
Who gives us the guidance for athletics?
Athletic guidance will come from CDPH as well,
Okay.
including VAPA and other activities there. Again, Placer County played a little part of that last year, but I do not believe they will be providing any more information this year at this time. And once again, we have been told that that guidance is forthcoming. Obviously, we hope to get that sooner rather than later.
But we are assumed back to the CIF schedule, which is fall sports and fall winter sports. Is that right?
Correct. CIF sports will move forward as
So
normal.
like football you didn't have to wear a mask last year. So what fall sports? Women's volleyball is the only
Indoor
one?
sports, and then
Which of the fall indoor sports, I guess, wear masks? You probably know more than I would, so.
yeah, indoor sports. Volleyball is the first one we have right out of the chute. Girls volleyball,
Okay.
and again,
And
football. was
last
the
year they
question.
played but wore masks.
They,
Right,
they
of course.
played in the spring, and then at that time, the focus was really on or physical distancing. You know, and then the other question that we have is in regards to testing, all
Yeah,
indoor
right,
sports.
right.
And then including football and water polo.
Right. Okay, thanks.
And I guess same regard with regard to PE, if I haven't, I guess in the fall, I'm assuming most freshman PE and that kind of stuff is outside, whatever. If there's an indoor element to it, we would,
At this time, we would recommend anything indoors, they would be masked. Anything outdoors, as Dr. McDonald just mentioned, no mask required.
and then door open, windows open, et cetera.
Yeah, we want ventilation is also
Obviously, yeah,
a
'cause you get
topic here
kids
we'll
sweating.
talk about later, but you are correct.
When you say you would recommend masks indoors, where's that recommendation coming from?
Once again, according to the guidance that was updated, they said anything indoors, it would be recommended mask. Anything outdoors does not require it.
And that's this California Department of Public Health, so that they did not distinguish what type of school activity or class they would, so they treat an English class like they would a choir class or a PE class in terms of how the guidance has been written from CDPH. And so we're extrapolating that currently until we get updated athletic guidance to be that if you're indoors, then CDPH says face covering, if you're outdoors, not. So if students are in a weight room, indoors, we would expect them, according to CDPH, face covering, but if they're outdoors lifting weights, they would not need to.
And then
Yeah,
same
and the
thing for
same for
indoor
use
lunch?
of locker rooms and other areas.
How do you want to manage that?
Indoor lunch, just like last year, it's kind of hard to eat if you have a mask on.
Obviously.
So again, the recommendation would be that we try to spread out a little bit indoors, but again, you have to be able to eat without a
Fair,
mask.
fair, fair.
Quick question on that. I know the next block is going to go more into masking indoors. I know this block is specifically outdoors. Some of these activities are not primarily outdoor activities, but could become outdoor activities. Has there been conversation with administration of moving as much as possible outdoors while there's good weather?
We will have those conversations. For example, I'm meeting with all secondary principals on Friday, and I have been texting because, as you can imagine, questions are coming in. We knew we were having this meeting today, so I asked them to hold off until we receive further guidance. But you are correct. As President Counter mentioned, a lot of our PE classes were moved outdoors, including weights at both of our high schools. So I would imagine, if necessary, they would continue to do that.
Yeah, and elementary PE is outdoors to the greatest extent possible, unless it's too hot, every class. Yeah, or rain. Well, do we get rain? Is that a thing? Okay, moving on to the next section, which continues the masking. So the recommendations from CDPH and now from CDC as well, as of today, is that K-12 students are required to mask indoors, all students, regardless of vaccination status. Adults in K-12 school settings are required to mask when sharing indoor spaces with students. And consistent with the guidelines from 2021, schools must develop and implement local protocols to enforce mask requirements. So a lot of the guidance this time, there's very few requirements. There's a lot of recommendations that we'll get into next. One of the requirements is to mask and that we have enforcement protocols in our schools. So in order, how would we interpret that is we would say all RUSD staff and students will wear face coverings inside school facilities, regardless of vaccination status per the guidance. School staff may remove masks when students are not present. That could be working in their classroom during prep period. That could be in a PLC meeting. Could be in office if students weren't present before or after school. We would issue information to families, students, and employees that face coverings are required indoors when students are present. We would post signage that masks were required, face coverings. We would provide face coverings to students or adults visiting the school if requested or needed. And then it comes down to enforcement, which is where we have the local control. So we because we don't have a clear answer and we absolutely want to hear the board's input on this, we have two different options that could be looked at for enforcement. One would be if our staff or students are not wearing a face covering indoors, we would remind them that it is required. If they don't have a face covering, the school would provide one. And if they refuse to wear a face covering, they would be excluded from school until they can comply with the CDPH requirements. Now, of course, there are exemptions for mask wearing, medical exemptions that are available to students, and there's also exemptions put into the guidance now. One of the things that I remember coming up last year was, well, my son or daughter receives speech services, and it's ineffective when you're working with your mouth a lot. There are exemptions for speech and other places where teachers would need to see the face and use the face. So that is one option that would be 100% compliant with the guidance given to us by CDPH. Option B would be make face coverings available to students and staff as needed. If a student does not have a face covering, the student will be reminded of the expectation and offered a face covering, but students and staff would not be excluded. Instead, we would have a system of warnings in place to remind students that mask covering was required in schools.
Okay, go ahead.
Just a question, a point of clarification. The wording in the left column, is that in abbreviation or is that quoted word for word from CDPH?
With the top?
Sorry, as we go through, the left column is directly from CDPH health guidance. Is that correct?
Directly.
That's not our interpretation?
Correctly.
That's what CDPH is giving us, and your recommendation to us is the right column.
Correct.
Two things. How have the health exemptions changed from last year? The masking exemptions.
They have not changed.
Okay.
So
So I thought you said last year speech.
I think that's more clear. I do think that one has been, I would say, evolved. So there was always exemptions available for students with special needs in terms of were they able to wear a face covering and for medical exemptions. Now it's very specific to like if there's a speech or communication issue, the face covering is, you can get an exemption for that specifically.
Okay. Could you please, hold on a second, could you please clarify CDPH versus CDC guidance, just for everybody to know on the left column? Why do we listen to CDPH versus CDC?
So the big national body is the CDC, the Center for Disease Control, and so they make policy for health for the United States. It's like our federal government makes policy for states. And then just like our federal government, like we have a state government in California, we have a state public health department, which is our California Department of Health. And they have the right to take federal guidance and interpret it and make it for the state of California so it's valid. So there's the high level CDC, CDPH, which is what we're more compliant to in the state of California. And then we have a local agency too, a Placer County Department of Health, who can also interpret and clarify that health guidance. What I understand is what they can't do at any lower level, well, actually at the county level. I think at the state level they can issue their own guidance, and they did in this case. The county level, they can't make the health guidance less than the state guidance is what they're required to do. So they can interpret it and broaden it, but they can't make it less than what the state is required. CDC is independent of the state. So in this case, like with the masking guidance, what first came out was CDC said, actually, if you're vaccinated, you don't have to wear a mask anywhere. You can be maskless indoors and outdoors, and that was like 3 or 4 weeks ago they came out with that guidance. And CDPH, when they came out with our school guidance, said, yeah, we heard CDC, but actually we're going to go stricter in California. We're requiring you to wear a mask in schools whether or not you're vaccinated, and they had a variety of reasons for that. Today, actually, CDC issued a statement where they said, actually, we're going to go back and go stricter, and we're going to align. They didn't say we're going to align with California, because no one likes California.
Yeah.
But they did, and they said, actually, we're going to go back and say we want everyone to wear a mask indoors regardless of vaccination status.
And just to also further clarify, CDC does not have legal binding on the state. It does in areas where they have jurisdiction, like interstate travels, like in airplanes. They can require that. But the CDPH, when accompanied by, under the emergency declaration, does have enforcement capacity or legal binding capacity in our state, but CDC does not. So the CDC is treated as a recommendation. Occasionally in the CDPH guidance, to further confuse things, CDPH will refer to CDC and say, see, their guidance is what we're going to do. But the legal binding piece is CDPH, not the CDC.
Okay, our next topic is on physical distancing. And again, CDPH, recent evidence indicates that in-person instruction can occur safely without minimum physical distancing requirements when strategies such as masking are implemented. Our proposal is, because physical distancing evidence is there, we will not require this to take place in any of our K-12 school settings. Classrooms, lunchrooms, and other areas impacted by the 2021 school year will return to traditional setups. So classrooms, as you can imagine, as we did it last year, we made that adjustment from that 6 feet to 3 feet. We ended the year. That's how we'll be starting the year out, because that's very similar to a traditional classroom model.
I would also add that some of our favorite words from last year, we would still want to do this to the greatest extent possible. And we would, if teachers are comfortable with their classrooms and their desks being 3 feet or 4 feet apart, and they want to continue to implement that or keep a shield in front of their desk, we're going to allow those all things. They're just not required anymore. And as much as possible, we want classrooms to return to normal instruction. And we'll cover the lunchroom piece later, but a lunchroom's a little different in terms of your question.
Okay.
I think I heard Roger say this, but I want to clarify just for my son. So I get that on classrooms, but are you also saying that rallies and special events also would, so that I think you said a back-to-school rally would happen. Is that in fact true? We are going to allow back-to-school rallies, and I would also ask sports too. Are we fully going to let?
That is the plan as of
both
now?
the football stadium can be as packed as we want it to be, and we have full back-to-school rallies in the gym.
Correct.
Okay, thank you.
Let's see here. As far, and again, sitting together in class, if it's a 2x2 desk or 3 feet apart or whatever, that's pure kind of teacher discretion, whatever makes sense best for their classroom and their setup? Okay, and doesn't matter K-12, okay.
Correct.
And maybe I'm jumping out. Things like drinking fountains and shared supplies, like, in art, everyone's using the same crayon box, et cetera. That's all kind of free for all, and we'll open up the drinking fountains. We won't have the little X's on them.
We plan on reopening those pieces, and we won't have separate materials for students. So like VAPA and other places would return to shared materials. So the evidence that they're citing says that there wasn't a lot of spread.
Yeah, I was going to say drinking fountains we're still going to keep covered and closed, because especially you think about younger kids, sometimes they struggle not to put their whole face and mouth inside the thing and turn it on, and he's mine. And so we feel, just out of an abundance of caution, students seem to be able to hydrate and carry, and so we would make that available, just a precaution. But as far as Dr. McDonald and Mr. Flowers shared, surface spread is not the issue. So sharing of supplies as we normally did and things would return to normal, but just the drinking fountain.
Same thing at all the levels, so high school kids that we know are pretty accommodating of drinking fountains and things?
well, your children may be different than mine. But we feel it's just easier to have that one standard piece. Also, because we're cleaning once a day like we normally would, if a student does do something, that kids do, we wouldn't have, like, we're cleaning every hour of those. And we felt that, again, students were able to hydrate through, we have water refill stations, we have water supplied. Hydration didn't seem to be an issue for students. And so we feel that we can, work with how we did just out of an abundance of caution.
Okay, moving along to ventilation recommendations for indoor spaces. Ventilation should be optimized. We will continue to use the MERV 13 system in all classrooms, offices, and indoor spaces. And as President Counter mentioned, we'll recommend that as much as possible to have the doors open to allow that wind to come through and clean out and get as much fresh air as possible. And that's not unusual, especially in the springtime. When we first start school, it might be a little warm out there, so classrooms will be closed up for the air conditioning. But again, we will optimize the ventilation systems.
Okay, the recommendations for staying home when you're sick and getting tested have not changed. So we continue to advise staff and students, if you have symptoms of COVID or anything else that could be nasty or contagious, that we want you to stay home and get well and get tested in this case. You'll see the guidance to follow is exactly the same between CDPH and what we're recommending, that you would, if you were symptomatic, you would not return for in-person instruction until you met the criteria, which is at least 24 hours have passed since resolution of fever, symptoms have improved, you've had a negative SARS test, or you have documentation that it's an underlying chronic condition like allergies or asthma, or you have a test and find out it's a strep throat that's resolved, and that would be 10 days since the symptom onset. So that has not changed from this year for potentially positive cases or symptomatic.
Question. Are we allowing the home tests now, or does it have to be at a doctor's office or clinic?
It's a good question, and I haven't explored that yet, but I will venture that we are not going to allow a home test, that we would require a doctor's test or a test at a local agency, Walgreens and other places where you can get them pretty easily.
Question. What list of symptoms have we adopted?
We're keeping the same symptom list that was provided by Placer County last year. The shortened version is like fever, cough, nasal congestions, chest congestion are the main symptoms we're looking at. I think we went from a long list to a short list that included those 4.
We received that from Placer County Public Health?
Placer County Public Health.
Okay.
Mm-hmm.
So in the, under the mask guidance around enforcement, you gave 2 options around enforcement. You don't, throughout the rest of the document, you no longer give options. Should I read into that you're not recommending options, which is to say if someone is symptomatic, they are not allowed to return to school and we will enforce that, or is that unclear?
I think we're always open to options and hearing different perspectives on this. I think in this case, this is a widely adopted practice in terms of if someone is actually sick and showing symptoms, they would be potentially contagious and we wouldn't want them at school. The 10-day part is more COVID related because that's the duration of the illness that has been given to us by CDC and CDBH and other folks. But in general, we would not want sick staff members or students to come to school who are symptomatic or coughing or congested.
I get we don't
Yeah.
want it, but if someone says, I don't care, I'm still going to come, how will we respond to that?
What we've done is we have sent students home who are symptomatic. And we did that before COVID, and we would do that during COVID even more to protect other students. Because if a student is sneezing and obviously ill or vomiting in class, that is not a safe place for teachers or other students. And so we would continue to do that, and we would urge them to get it, in this case, to get a COVID test because we know those are symptoms. So we would continue that practice.
I did notice on here, there's a use of or in a few spots. Could you speak to that a little bit? So point 3, of that where it goes into they must have a negative test or a healthcare provider provide documentation that symptoms are typical of an underlying condition, or a healthcare provider has confirmed an alternative name diagnosis, or at least 10 days have passed since symptom onset. So am I interpreting that correctly to say that if a student has one of the 4 main symptoms that Placer County has identified, public health for us, but they visit a doctor and a physician on day 1 of those symptoms, well, let's say day 2, because point 1 is 24 hours, no
Yep,
symptoms.
correct.
So if they've cleared 24 hours, no symptoms, so that clears out point 2, symptoms have improved, and then point 3, they have a doctor on day 2 that says, this was a stomach bug that's unrelated, or this was strep throat, whatever.
Correct.
And the doctor feels that are we looking for a letter? How does that actually play out?
Yeah, we're looking for 24 hours, we're looking for symptom improvement. Those are the 2 qualifying events. And then there's one of 3 options. You can get a negative test, which you could say, I don't have COVID, I can return, I've improved, I'm not sick anymore. You can have a doctor do 2 things. One, say, actually, this is strep throat, which we still probably wouldn't want to come back in 24 hours, or something else that's not COVID, and I've diagnosed it. Here's a note, so they can return, and then doctor would determine when you come back. The doctor can also say, I've been treating this student for asthma for 2 years. I can tell these are symptoms of asthma. Here's a note that says this student has chronic asthma, and I want them to return to school, and they could return to school.
And that's what we did, based on Placer County Public Health's interpretation of the California Department of Public Health guidance. We had that practice for doctors to make that determination as long as they submitted it in writing to allow students to return. So that wouldn't be a change from actually.
But that's, yeah, I think that's a symptomatic. So I come to school hacking of cough. I go see my physician the next day. Hey, Derek, you have asthma. Here you go. Let's just call it Monday, Tuesday, Wednesday, you're back in school, right? Is that kind of ballparkish?
Correct. Yep.
One more question. In the event a student does test positive, so they're symptomatic, they test positive, or the doctor says, hey, I'm concerned, I do feel you should be home, what is our educational learning plan for those students? And I know that's probably a very long answer. I don't need the full answer, but do we have anything new other than what we last discussed at a previous board meeting for quarantine students due to symptoms? So they are ill, they need to remain at home. How do we educate them?
So we would immediately go into kind of teacher providing work for the student at home if they were able and willing to do it. If it was a longer-term situation, we now have independent study that can be as short as 3 days. So they could enter an independent study situation where they completed work each week. Because some students could be in quarantine for longer than, for symptoms and be sick for longer than 10 days if pieces don't resolve, so we could provide that. The other alternative we did talk about at the board meeting and is still on the table is if and I think we'll see later in this guidance, and I think we all are hopeful that we will not have large numbers of students in quarantine, but if we do, we have an option to provide some sort of home teacher for groups of students who are at home. I mean, with emergency funds, that's something that we proposed last time, and we'd be willing to look at again as an option to support students who remained at home for a long period of time.
At the secondary level, our main communication would be through Schoology, like it traditionally has been, but as Dr. McDonald mentioned, if it's going to be an extended time, then we have funds to hire someone to go out and provide some of that. At times, that's similar to what our home hospital instruction is. That creates a challenge at the secondary level because traditionally you have a single credentialed person going out. So a science teacher may be trying to help someone with advanced math is a challenge. But that's where we do ask our teachers to continue that open line of communication, email with FaceTime, things like that. And many of our teachers do that already and have done that for a number of years. But yeah, our main point would be through Schoology to keep them updated and provide that, and then through email.
Do we have anything in place that parents can expect as far as 20 minutes a day, a check-in? I know before we would revert back to because there was mass quarantining, but hopefully that's not the case moving forward. But for those individual students, that's huge. If they're out for several days at a time, what can a parent expect? I could imagine that would look very different teacher by teacher. Is there some sort of document that we give or understanding of this is what a child or a parent should expect?
At this time, we have not discussed that yet. Again, we'll be meeting with principals later this week and our district leadership team next week, and we can be discussing that information at that time.
Can I ask also, when you guys discuss that, I know you're aware of this, what Rocklin High School counselors did. I'm not suggesting that for everybody, but it did work. So be sure that when you guys have those discussions, will you talk about what did work last year and what really didn't work? And so let's find some solutions that families can have more success.
Sure, definitely, it's a team effort, and when we talk about our students, they are truly our students, so we all need to step in and support that student the best possible way.
In addition, some of the concerns we did hear, and that's where the additional staff is, that, beyond, is making sure if a student, say, is struggling in an area, that how do we get them that help? So that's where we're looking at hire additional staff to make sure students have that support, but also that connection as well. And so that's where, like, that home hospital serves as that general kind of assistance to students, clarifying, understanding assignments beyond what the teacher can do. So we definitely know that we need to have more engagement with certificated staff with students who are quarantined, and make sure that it goes beyond just, hey, did you get this, did you get our information, are you there, but how do we really support you, so in that struggling to learn. And then the other, Frank, piece that really made it a challenge was we had we had increasing numbers of students that were quarantined because of the guidance we had in place, and that made it a challenge for teachers. We are very hopeful, given the new information on quarantining, that we will have a lot less students that are in that situation, which makes it manageable for a lot of the ways we've supported students traditionally to work, because we really didn't have the issues related to this until we just had the vast numbers. And then that took what we normally do and really made it a challenge. So we're hoping with some additional resources and less students that we can reset to where it's helpful for students and keeps their learning going while they're gone.
In addition to that, as we presented in our learning loss plan, we do have extended tutoring hours for students. So I know at the secondary level, if they've been out, say, for a week, we will have that available as well to come back. Online is a possibility.
If they're quarantined, how would they do tutoring otherwise?
Once they are able to return.
When they get
to
back.
help them
Gotcha.
get caught up.
Okay.
Plus period's already set, and this is extended hours after school. Okay, moving along, quarantine recommendations, and you can see here, there are recommendations for vaccinated close contacts as well as unvaccinated. So going through the CDPH guidelines for those that are fully vaccinated requiring quarantine, RUSD staff and students who are fully vaccinated and present evidence to this effect will not need to be quarantined for exposure of a close contact or need to follow other quarantine recommendations for unvaccinated close contacts. So again, understanding that maybe as early as our middle school up, that's a possibility. It's not yet a possibility for our elementary students. The recommendations for unvaccinated close contacts, you can see there on the left, CDPH, when both parties were wearing a mask for indoor classroom setting, unvaccinated students who are close contacts, and that means more than 15 minutes over a 24-hour period within 0 to 6 feet, may undergo a modified 10-day quarantine as follows. They may continue to attend for in-person instruction if they are asymptomatic, continue to appropriately mask, undergo at least twice weekly testing during the 10 days of quarantine, and continue to quarantine for all extracurricular activities at school, including sports activities and community setting. Our recommendations moving forward, when both parties are wearing a mask in indoor classroom setting, very similar. Unvaccinated students, close contacts, again, 15 minutes, 24 hours, 0 to 6, may undergo that modified 10-day quarantine as follows. They may continue to attend school in-person instruction and participate in school activities and athletics if they are asymptomatic and continue to appropriately mask. Weekly COVID surveillance testing is optional, and that'll be available at every school for our staff and students at their request.
How would, sorry,
No, you go ahead.
how would they get it? If they're quarantined, how are they going to get the testing from the school site?
So again, we're working on that. We are going to be training some of our health aides on how to do that, and we could schedule some time for them But they could always go, again, as Dr. McDonald mentioned before, there's other testing available.
But if they were getting it from the school, would they come out to their house, or would the kid come to the school from quarantine?
I think, if I can clarify, this is, the testing would occur as if a student is not symptomatic and wanted to not be quarantined. So the idea being here is if you were both masked and you're in that, that contact zone, then if you have no symptoms, you can continue at school and participating in school activities. And so the testing would be, if you wish to have that, we would have it available for convenience sake. So there would be at school under this to receive that testing.
Thank you, Superintendent Stock. I forgot that asymptomatic.
It would be another layer if they wanted another layer of safety.
And again, so going down the same path, asymptomatic, close contact, wearing my mask the next days or so, if I got a test and it was negative, then I'm off the list, or do I still continue the 10 days?
Still continue.
Okay, so you write it out, regardless of the test result, I write out the 10 days.
But you can still,
No, so,
Well, this is only if you're asymptomatic, you would continue to attend and participate and mask appropriately.
okay,
and if you tested and were negative, you would still continue for 10 days because COVID could
I guess I'm
appear.
trying to figure, you're on the list, is what I'm trying to figure out, when you walk off the list, is where I'm going.
You could still develop COVID in the 10 days, so you would test twice.
Right, and
if
again,
you
this
want.
is not somebody that's COVID positive or symptomatic. This is somebody that was exposed, and so the difference is they don't have to wait out the 10 days at home. They could, if they, again, don't have symptoms, attend school and the activities. And that was the largest number of students that were quarantined, was in this scenario that we had, is they were exposed to somebody that was positive and then had to wait out that quarantine period, whether or not they were actually COVID positive.
And this is where you always have to read closely, because if you look at it, you have vaccinated, you have unvaccinated, you have masked, and then the next one moving forward, quarantine recommendations for unvaccinated close contact who were not wearing a mask, or for whom the infected individual was not wearing a mask during the indoor exposure, or unvaccinated students. For these students, those who remain asymptomatic, meaning they do not have any symptoms, may discontinue self-quarantine under the following conditions. And again, because the titles are gone, this is the CDPH guidance. Quarantine end after day 10 from the date of last exposure without testing, and here's that "or" that Trustee mentioned. Quarantine can end after day 7 if the diagnostic specimen is collected after day 5 from the date of the last exposure and the test is negative. To discontinue quarantine before 14 days following the last known exposure, asymptomatic close contacts must continue to self-monitor from day 14 from the last day of exposure, and follow all recommended non-pharmaceutical interventions such as wearing a mask, hand washing, avoiding crowds through day 14 from the last known exposure. Now, going back as far as our recommendation, very similar to what I just read, we will follow this guidance. They can return to school, work, activities, and athletics. Once again, quarantine can end after day 10 from the last date of exposure without testing, or if they want to end sooner, after day 7, if a diagnostic specimen is collected after day 5 from the date of the last exposure and the test were negative.
Couple questions, thank you. I have a few thoughts and comments on quarantine, but right now I want to make sure I fully understand the recommendations or the conversation that we're having. So, a couple questions regarding the vaccinated versus unvaccinated. How would we know if students are vaccinated or unvaccinated? It says on here, present evidence to this effect. What does that mean?
I want to find, what piece exactly are you looking at?
Oh, sorry. Under the, where it says quarantine recommendations for vaccinated close contacts, for RUSD implementation, it says RUSD staff and students who are fully vaccinated and present evidence to this effect will not need to quarantine.
Right, so what?
How does that actually play out? Are
Yeah,
they
so this-
bringing something?
Yeah, so this is that, there's a choice piece here, because we can't force people to tell us their vaccination status, and that's, because that's private. But what we can say is, if you've been exposed to a positive case and you were unmasked, if you can say, hey, I've been vaccinated, and you want to show us proof of vaccination, you don't have to quarantine. So you don't have to follow that guidance. If you say, no, I'm not vaccinated, or I choose not to tell you, then you go into follow the quarantine guidance.
Was the same guidance that we were implementing when that came out last spring. So we did have, in that case, students and our staff show proof of vaccination and then did not have to quarantine. So that is actually no different than how we were implementing guidance in the spring.
Okay, thank you. I just want to make sure I'm fully understanding some of these pieces before I give my comments and thoughts. On the next box down, on the bottom where it says weekly COVID-19 surveillance testing is optional and will be available to staff and students at their request, how does that actually play out? Who conducts it on the campus? And then who makes the decision for the minor, the student, as to whether they're requesting it, the parents requesting it? How does that communication play out?
So since February of this year, it seems like a lot longer, we've had that nursing team that's gone to all our schools on a rotating basis and tested staff and students at their request. So there's a sign-up form. They can register for a date and a time, and the team comes. It takes 2 minutes. Actually, we've had it for all staff in our USD, including our district office. So that will still be available. So anybody who wishes to test can. Marty, you may have to clarify at the high school for me, but in elementary school, we didn't test any students. There were no requests to test. And my feeling on that as a minor, that would be a parent permission to test. We would not test a student without parent request in elementary.
I'm not aware of any middle school or high school that volunteered for that test. Obviously, we had a lot of athletes testing, you know, and that was required for some of those.
We would not test any student under 18 without parent consent. Obviously, if a student's 18, then legally they can consent to that. But we would want, you know, at any age under 18, parent consent for any testing.
Just looking forward and for athletics in the fall, are we testing kids prior to games per week and all that stuff?
So if you recall, that testing was based on the tiered system. And if we were above 7%, then we were required to test. And there was a couple weeks where we started the week off below, and then by the end of the week, we're above, but because we started. So we are waiting for that guidance to see if we have to test. Again, our competitions are still a ways away, and the testing was required 24 hours prior to a competition. And so hopefully, correct.
Just a point of clarification and making sure as we're able to discuss with each other and throw this out there. I'm throwing out thoughts and ideas, right?
Sure.
We just were able to talk with legal counsel. I know this was prepared before that. But just a thought or a question. I'm looking in the left column now for the quarantine recommendations for vaccinated and unvaccinated. I notice it does say often recommendations, whereas the masking was a little different. CDPH, I know I've asked the question, is this required? Is quarantining required, or is it recommended? I think those are different conversations depending on what CDPH says. I'm just wanting to draw attention and make sure that is accurate. CDPH recommends quarantine procedures. However, to date, there's not a state public health order or a Placer County public health order mandating any form of quarantining. Is that correct?
Correct. Okay. So we are moving on to isolation guidance. So isolation guidance is similar to what we talked about before, which is when we have positive cases of COVID-19. So CDPH is recommending for both unvaccinated and vaccinated persons to follow the isolation guidance if you're diagnosed with COVID-19. We, again, are advising staff and students with COVID-19 to remain at home. They can return to work, school, activities, athletics when they meet the requirements below, 10 days, have passed since onset, 24 hours have passed with resolution of fever, and other symptoms have improved.
And it's 10 days since symptom onset, so I can't say that. So I have symptoms on Saturday, I go get tested on Tuesday, my day zero is Saturday, not necessarily the
Correct.
Tuesday when I get tested. Okay, fair.
Correct. Yep.
And then I guess, if I were to get tested and I'm negative, then it goes back to you didn't, it's not you didn't have COVID, so it follows a different protocol.
So the assumption in this one is that you
I'm
have a
positive.
positive test.
Fair,
right?
fair.
And you can't test out of a positive.
Is there at any point that the testing is mandatory? It's still, in all the guidance so far, it's elective to test. So it'd be essentially somebody was showing symptoms, or I guess they don't have to. They could just say, hey, I want to go take a test. And we're saying, according to this guidance, if they receive a positive test, that's where that block applies.
If they receive a positive test, and the alternative to that is you're symptomatic, and we follow that symptomatic guidance where you still have to stay home for 24 hours or symptoms resolve, and you should go to your doctor, and they'll probably test you.
If they choose not to test on site, how are we notified of a positive test?
We ask our staff and students to notify us, but we are notified by the county in a database if there's a positive test.
If they're a registered student, the county notifies us?
Right, I mean, the county, like, the public health department conducts contact tracing for communicable diseases, and this was SARS back like a decade ago, and with this, and so they have a contact tracing database, and so, you know, in that case, then and that's been, and we also share, if we have a positive test that we're aware of, we also require to report that to the county public health department. So there is that would be a mechanism that we might find out, that a student, say, tested positive over, say, winter break, and then we would be notified. We've had phenomenal cooperation from our staff and our families around letting us know if they've been in that, and that was just a phenomenal partnership, and we were able to trace that, make sure everything was followed, and so, but we're required to inform the county of any positive tests we're aware of, and then they do the same. That it's not an option, it's a legal requirement because of the communicable disease piece of this. And it's no different than if a student were to present a fever at school, you know about this, and we know the nurse takes the temperature, says child has a fever, we're not gonna send the student back to class. We're gonna contact the parent and say, you know, Ms. Smith, can you please come get your child, they have a fever. And if the parent can't, then they're going to sit in that health office, and we'll do our best to take care of the child, but we wouldn't put the child back in the class with a fever. And so, in essence, that's when, if a student were to present like that, that's exactly how we did that last year, is we, you know, worked to keep everyone safe. We contact the parent and ask them to come get the child. And those types of things, like fever and anything else communicable, like, you know, lice and things, we've had forever. Ways we communicate, we work with families, and so a lot of those protocols work really well.
So moving along, as far as hand hygiene, these recommendations, and this is really part of our schooling we do anyway. So the CDPH there, we are recommending that. As far as our elementary schools, spend a lot of time teaching kids and reinforcing the hand washing and avoiding the touching of the eyes, nose, and mouth. And then even in our, for example, our science classes, this is a recommendation that kids at the end of the period continue to do that. And in our CTE classes, so just for time's sake, we will be following through. The last part of that is that we will ensure adequate supplies to support healthy hygiene. We will continue to provide the hand sanitizer in our classrooms and around our campuses to ensure that students are clean.
And that's K-12, obviously. So I know there's a handful of elementary school. Is that the expectation, hey, walking in, everyone's going to wash their hands before they sit down, or when you go to the restroom, in and out of lunch, et cetera?
All the above.
Okay.
Once again, it's just kind of part of educating for a clean, safe environment.
So cleaning recommendations. So the recommendation is, in general, cleaning once a day is usually enough to sufficiently remove potential viruses maybe on surface. And so we plan to continue to disinfect classrooms, offices, bathrooms, other common areas daily going forward.
We've hired additional custodians last year that we continue to have employed to give us an additional resources to be able to accomplish that.
Just real quick, and maybe it's Craig. I know in some cases we've used those fogging machines and that kind of stuff. Is that, or is it more spray on, wipe down? It's spray on, wipe down. Okay, perfect.
For food service recommendations, maximize physical distance as much as possible while eating, especially indoors, and then use additional spaces outside of the cafeteria for mealtime seating, such as classrooms, gymnasium, and arrange for eating outdoors as much as possible. So really, nothing's changing as far as meals. We're going to try to maximize distancing. We are, out of an abundance of caution, we're not going to have any self-service. We're still going to do pre-plated, offering the food pre-plated to students. So we still, like all the speed lines and those, will not be in operation again starting this year.
In regards to visitor recommendations, RUSD, all non-employees desiring to volunteer on our campuses will be required to wear face coverings and then self-screen for COVID. We realized that was a challenge last year because, especially in some of our elementary schools, we did not allow visitors on campus, and even at middle and high school. But this year, we will be moving forward. However, we will ask them to wear a face covering and self-screen. Anyone not feeling well will be asked not to be on our campus.
So I want to ask that same clarification I asked before. So before on face masking, we were given two choices, A and B. We're not given A, B here. So does the assumption mean even if B were chosen by the board that you must wear a face mask even if everyone doesn't have to, if you're going to volunteer in our schools, and we would enforce it, or is that not the case? Or would it revert to the same process we have with everybody else?
At this time, we would ask them to wear a face mask.
I know we'd ask them, so I'm asking about enforcement. I guess my main question is the theory here to align everything with whatever, if we decide to enforce it differently, all mask enforcement would be the same? Or will there be differences for mask enforcement depending on who you are and what you're doing?
I think that's the conversation point for the board in kind of three senses: students, employees, and then visitors.
Okay.
That could be there. So I think there could be distinction and differentiation. And the board may consider lines along who's required to be there, who's not required to, who has an option to be there. But that was our sense of.
Okay, thank you.
And I think because we didn't put options except for face coverings, that felt like maybe had the most potential for conversation. So that doesn't mean, I think we're open to recommendations in the other areas as well.
And in the same regard, so your outside vendor, somebody coming in to do work on a baseball field or fix something, lights, that's all normal, get in, bring your work stuff, go.
Yeah, anything outdoors.
Anything outdoors,
Is different,
okay.
and that's why I paused, because we don't have a ton of volunteers on secondary. It happens, but.
No, I'm talking about the parent
elementary-
volunteer in the elementary class that wants to
Yeah.
come in and work in her child's classroom. Yeah.
This goes a little bit along with the next block, but a lot of other districts have opted a self-attestation model of whether it's the staff or the volunteer. Was there a conversation about that?
I think we're going to touch base on this on the very next one.
So in terms of vaccine verification, CDBH is strongly recommending for all eligible people in California that they get vaccinated. And what we're interpreting this is per Cal OSHA. So there's two things operating. There's the CDPH for kids in schools, and then there's Cal OSHA for offices like the district office or if kids weren't present. So at this time, we're asking employees in an office setting that they complete an attestment form for vaccination status. So again, as I shared earlier, they can say, yes, I've been vaccinated, choose not to share that information, or no, I have not been vaccinated. And based on that response, that would opt whether or not they, in an indoor setting, in a workplace, they either don't have to wear a face covering following the guidance, And if they choose not to tell or that no, they would continue to wear a face covering indoors. And so that would also apply at schools if children were not present. So in a staff meeting or in an office. So that, again, we would give employees that self-attestation form, and depending on their response, we would expect them to follow through with the appropriate masking.
Cal OSHA requires us to conduct that attestation and then keep a record of it as well. And so that is the process. Actually, we began that in the district office as soon as that came out because we were open and operating. And it's a simple Google form where employees attest, and we can document that. And
So the practical way that plays out, if you're having a PLC, is the teachers who have proven their vaccination can choose whether or not to wear a mask. The teachers who have not shown their vaccination for whatever reason must wear a mask. And so you would theoretically walk into PLCs and see some wearing masks and some not.
And people can choose to wear a mask irregardless. And it's the other distinction to make is it's a self-attestation. We aren't requiring employees to show a vaccination card or turn in a document.
But you are requiring them to say whether or not they were
Right,
vaccinated.
and we checked with legal counsel and our liability carriers, and they approved that self-attestation met the Cal OSHA requirements.
Trustee Soft, did that answer your previous question? Okay, I just checked. Okay.
So moving along, again, as mentioned previously, athletic guidance, unfortunately, it's forthcoming. However, we are breaking down this guidance, and as you can see here, masks are optional for outdoors for K-12 school settings, including athletics. Question that came up is last year, if you recall, locker rooms were off limits. However, they're allowed to use that this year as long as they have a mask on when going in there. And then very similar to our performing arts, our teachers last year made adjustments, and it was very frustrating because there was very little guidance given as far as singing and things like that. However, they adjusted, and schools built facilities outdoors to allow for this, and it was actually a pleasure to go on campuses and hear some singing. So again, when indoors, if they have a face covering on, but the recommendation would be if they want to do that in a large outdoor setting, then they're allowed to do that. Once again, we are waiting and checking daily for this athletic guidance, as you can understand, especially football is starting up, and then our other fall sports will be starting next week.
So like a play, some kind of drama presentation, that's an indoor event unless they do plays outside, which I don't think so.
But what's nice is we can have the play, according to CDPH guidance, we can have the play, full audience, students have to wear a face covering indoors. So the difference was last year we had limited seating, spaced out, and then even like choral could not occur indoors, it had to be outdoors. So there, that's where there's kind of a more return to normal, not exactly at normal. And again, we're waiting. This is our best application of the July guidance to what we have now while we're waiting for further specific guidance in this area. But we're not waiting to have it. We're working to apply the current guidance to these situations as we know things have evolved versus say we're going to be stuck in last spring when we know we have companion guidance that's allowed us to evolve how we conduct things. Hence, we weren't using locker rooms last year, but we feel we can, now this year. And so.
And I guess that's similar for opposing teams, like no matter the county, no matter the area, that's what we'll, yeah, just to make sure, I don't want kids changing on buses where I'm going.
Yeah, that was a challenge last year with some of the teams with, Sacramento County, and again, a lot of those recommendations was you stayed within a county or a neighboring county. And again, some of our football teams, for example, have games outside of Placer and Sacramento. So we're hoping, I did have a conversation with CIF, they are hoping as well. We want to have as normal athletic season as possible.
But that decision around playing outside of the county, that also is CDPH, not CIF?
Correct. To the best of my memory, that was the recommendation from CDPH.
So I seem to recall CIF making decisions last year that had impact on us. Do they make any decisions, and is it all CDPH that we're waiting for?
I think very similar to us. They try to follow that guidance as close as possible, and somewhat frustrating because.
So I guess what they did was, I'm trying to remember, 'cause I know that taking all the sports and playing at the same time, that was a CIF decision, which they've already said, CIF has already said, we're not doing that again, we're going to go to
We're
Mars.
moving forward.
Well, actually, I'm gonna sorry, because we're all, it's, you know, short-term, long-term memory. CDPH came out with that in this tier, in this color, in this orange, you can play these sports, in this yellow, you can do this. And CIF reacted to that to try to make structure out of chaos. And so, frankly, I would say is CIF does a great job, but we were hoping they would take more of a leading role in advocating and helping guide us. And frankly, they deferred us to CDPH for all the legal reasons that we all were held there. And so what we are excited, as Mr. Flowers recommended, is we don't have any indication that we aren't back to traditional fall, winter, spring sports. And so we're anticipating the big question in our mind is the testing piece for football, water polo, and indoor sports. That seems to be the big unresolved question for us regarding athletics.
What about attendees at those events? If it's an indoor event, a volleyball tournament, a volleyball game, a parent comes, a family member, I don't notice anything on here for attendees.
Similar like Superintendent Stock said, last year it was limited. We are planning on moving forward, following this guidance. Outdoors, everyone's welcome. Indoors, it's going to be a wait and see, but hopefully, once again, we will have as normal as possible athletic seasons. We will have parents indoors, but again, I hate to predict anything because you never know. It's changing, as Superintendent Stock said in the beginning. We're waiting and dealing with ever-changing guidance.
Kind of if I'm going to play weatherman and kind of forecast, and again, that, you know, is forecasting, I know, but we're in a study session, we're discussing. So I would predict that we would end up with, if it's an indoor setting, you wear a face covering. You can kind of see the pattern. And if it's an outdoor setting, you aren't required to, but we don't have to space or limit attendance. So it's since anybody can come that wants to, we don't check vaccination status, but indoors face covering is required, outdoors it's not. And at least from where we sit now with the guidance, if we had to all of a sudden do an event tomorrow, that's based on what we know today, that's how we most likely operate that event.
Is that a decision RUSD is making? Is that?
That's a decision that our USD is looking at, you know, in our interpretation of the guidance. We can absolutely, if we have fine points of clarification, reach out to county public health to say, this is how we're looking to, you know, interpret this and apply it to this event. Are we in compliance with the guidance? And they have been very helpful in the past of giving us saying, yes, that's in line, or no, you might think about this. So if we have an upcoming event that we were unsure of, we would reach out to them and seek that guidance from them. So for example, we're having our Learning Fest next Friday. Oh my gosh, already. And that's a big event where we welcome back, you know, focused on our teachers and on our employees. We're going to hold a convening like we normally do in the gymnasium. We will ask staff to attest to that. If they do, they don't need to wear a face covering. If they don't, they do. You know, that's what we just kind of shared in that environment. We won't have students present in the gym, so it doesn't create an environment. And we feel comfortable, we understand the guidance to apply it to that situation. In the same as where if we have a clarification needed, we would reach out to county public health in the meantime.
Yeah, if we could reach out, I think that would be helpful, because I think where I'm a little confused, although I think I understand the recommendation. I'm trying to, we're having our staff self-attestation. However, if we have an event, individuals coming in, them being able to self-attest as well, similar to if you were to go to a grocery store, you were to go to Costco.
The distinction is if students are present. So typically, like at a game or something, students are present, and that seems to trigger the difference on when that's required or not.
Okay, and is that why, so jumping back real quick, just because not everybody could hear when we were talking a minute ago, jumping back to volunteers, I didn't fully understand. So volunteers are not doing a self-attestation. We are having our volunteers all wear a face covering, no matter their status, and no matter whether they want to self-attest as well. Is that correct? That's the recommendation here?
That is the recommendation, yes.
I think
Right.
the assumption in that guidance, and you point out a good piece, is that we're assuming they're working with children in a school setting, but if it was like more a PTC in the gym setting up, something with no students present, then we could go the other direction and do a self-attestation, because that would be no students present.
I understood that was not the recommendation. I understood Roger to say that's what we're going to talk about today.
Yeah, I mean,
Okay, so that's not a recommendation we're
Right, no, I mean,
talking about,
I
so-
mean,
but it's
that's
still-
what we're putting forth is, here's
Right.
our best thinking as staff.
Right.
With how to implement the current
But I do
guidance
think
we
this could
have
lead
for
to a
our
lot of
schools.
uncertainty and a lot of lack of clarity. We could think we all agree on something that we don't. So I do think having clarity before we leave is going to matter a lot.
Absolutely.
Just real quick on the athletic guidance and that stuff. Are we going to be consistent between the schools, and are we going to be consistent between leagues? So if we say, in theory, hey, we've got a girls volleyball game, and if you come to Rocklin High School, you wear, but if you go to Wood Creek High School, it's not, I'm just, again.
Sure,
sif-
so yes, I've already met with athletic directors, myself and Craig Rouse, as far as facilities, and we've already had one meeting. They are helping me look at guidance as closely as possible, and also, they will also have a league meeting. As far as.
We're all on the same page?
pre-league, it changes a little bit, because again, different counties have different reactions to this, but we will be consistent here in Rocklin and hopefully within the SFL.
Is it possible within that the SFL or CIF could add additional kind of saying, we will mandate masks, we will mandate distance, or whatever? I'm not saying they're going to, but do they have the ability to do that?
I'm not sure, again, as
I think all they can
Superintendent
do is
Stock mentioned,
recommend.
we were hoping that
Yeah,
CIF would
CIF
take
won't.
more of a leading role, but
So
very
given
similar.
that they didn't, you're saying they're not likely to do it this time. Gotcha. Okay.
Okay, for transportation guidance, whether vaccinated or not, everyone is required to wear a mask on the bus. So basically, nothing is changing on transportation other than we will be seating, like we did prior to COVID, 2 to 3 students to a seat. We'll have masks available if a student does not have one. We'll maximize outdoor air ventilation when possible, and the buses and touchable surfaces will be sanitized daily.
Just looking back at last year, do we have enough capacity on the buses to space kids out and still, we're not saying Derek can't ride the bus, but Julie can because I'm out of space.
That is correct. Currently, we're planning for one more additional route than we had last year. But again, we will be, if we have the same number of students that want to take the bus as we did pre-COVID, then we'll be seating 2 to 3 seats,
Okay,
students on
perfect.
the
We have
on the
capacity.
bus. Yeah.
So President Counter, that concludes the document staff prepared for this study session. But we're obviously happy to, entertain any questions or as the board chooses to discuss.
Real quick, if you guys have, yeah, go ahead.
Before we open it up, I'm going back to the front page. This is my final one. I wanted to make sure I really understand what you're presenting to us. So this is the masks, face coverings. So couple follow-ups. One, how does that exemption actually work? Because I know there's been conversation that things have changed, but yet teachers I talk to feel it hasn't really changed. So what exactly does that mean, an exemption? Does that mean an option of a cloth face covering versus a shield, or the option of no face covering, and who deems that appropriate?
So we've always had an option for teachers and staff or even students to wear a face covering. So our shield, yeah, our process is like an interactive process. If you come to us, a student or a staff, and say, can't wear a face covering because I have asthma or, infection or whatever, we will say, okay, well, can you do this? And can you wear a drape? Can you wear this? So we'll work with a person to provide something that works but still meets the guidelines. And a face shield absolutely meets the guidelines with a drape. The exemption piece is different. That's the medical exemption. So that's the part where we have a form that we provided to parents and students and staff. If you can have your doctor complete the form that you have a medical exemption or reason not to wear a mask, we will review that and grant an exemption once that's complete, and our health services team would look at that.
That's dependent upon their physician of their choice.
Correct.
And then, just going back to that, those plexi shields that were created and made, is that I guess, I mean, is it the same? So if we have a shield between us, no mask, or is it still the mask is the expectation?
The guidance reads masks inside and doesn't mention shields. I think, if I'm remembering correctly, Roger, but the research on the shields, plexiglass, actually is that it was not helpful in containing the virus and actually may have caused more contamination.
Fair.
However, we have them, in place in offices, and if teachers request them in their classrooms, we've not removed those. If a teacher still wants to have those, or office space does, we will absolutely have them there, and if people request additional ones because they want them, we will provide those as well, though it doesn't provide any change in masking, spacing, anything at all, but it's just really more personal preference, and we're happy to work with employees to have those if they want them.
Okay, and then my second part to that was just seeking clarification. I know on here I'm able to click that link, the potential coverage for districts following but not enforcing mask mandate. There's been a lot of talk of that in the community this last week. There are other districts that have said we would like to focus on the learning loss that we know that we're not surprised by, but we know we need to spend our time and our effort, and we want to allow parents and individuals the ability to make decisions for themselves. And so there's been a lot of question, though, of surrounding districts that have essentially said, hey, here's the guidance. Here's what we are expecting, what CDPH is asking us to expect of you. When it comes to enforcement, here's how we will enforce. We will remind you, we will let you know there's signage up, but your child will not be removed from education. I didn't see a lot of that on here, and I know that's a hard line, but I do think our community's gonna have a hard line there. They wanna know, how does this actually play out? What happens? Option A and B, it makes sense to me. I think there's still a little bit of vagueness there of what actually plays out. Is a student sent to the office? Does a principal have a conversation with them? But I don't know if we have answers to that. We may not. So that would be, I guess, point B of question 2. But I do think it's important for those that can't see this right now. We did have a little bit of extensive conversation with our legal counsel on that is a hard one, because there is that conversation and question of, will we have concerns with our insurance coverage? I would like for us to see a very direct response back on that, because the insurance company, the statement that they publicly put out, says intentional disregard of laws will negate coverage. Variation of enforcement is not necessarily an intentional negation of law. And so I think that one, I don't know if there's been conversations already, or if we can get more of a response on that.
We can ask legal counsel if they can be more definitive in the response. I'm not, we'll ask that. I'm not confident that they'll be able to give a black and white answer. I think what we'll hear is shades of gray. The stronger you adhere to the CDPH recommendations, the stronger legal position you're in regards to liability and other related issues. The further away you move, then you increase your risk. So we will ask the question to see if we can get a more definitive answer for the board, but my thinking is that we'll probably hear shades of gray and in regards to that. So what we've put out to the board is we in no way are recommending that we disregard CDPH. What we are put out is an option A or B on, do we send students home if they do not comply? And so the option we put out was never to disregard the guidance, which would put the district in the worst legal position because we outright are just not following it. But it's the enforcement of it is the question comes down to, do you exclude students who fail to follow it, or do you not? And then you can look at different ways of the enforcement, such as, okay, 4 warnings, 5 warnings, 100 warnings. At some point, what are you warning about? And so that's where we did put the 2 options there, and they have different weights of legal liability protection, but in no way were we recommending outright disregarding of that legal mandate from CDPH. And so we could bring back how might that be enforced, but we have a lot of school rules, as our students know, And there's the mechanisms we normally use to enforce school rules. Typically, if an adult sees a violation, they talk to a student, redirect, try to correct behavior. If that's not successful, then there's tiered pieces. Ultimately, they could be sent down to the office to talk to an administrator. And so that type of process would be what we would do in something similar to this as well. And then in an individual teacher, staff members have different, sometimes, ways they look at in issues within a campus too as well. And so, so those would be the typical patterns of how we would work with something. And one of the other pieces we really rely on is that, especially in cases of classroom, that teacher contact with parents, because we know that communication often is very, very helpful. And so those types of normal processes would play out even in something like this. The real question comes into, do you send children home from school if they won't wear a face covering at some point, or do you not? And we've all, I think, recommended and been saying we would acknowledge the requirement, we would post signage, we would provide face coverings if anybody needed one, we would issue reminders, but it's that last piece of, do you send children home? And so that's where we kind of left it with the board. But we can play out more scenarios if you'd like. But we will ask legal counsel for a more definitive answer if we can get one.
No, that's helpful, right? I'm reading it and I'm thinking, oh, what would happen? Like what actually, and the final part of that, so I'm guessing the self-attestation for students, is that due to CDPH saying whether vaccinated or unvaccinated must mask? Is that why there's no even option for students to self-attest whether they're vaccinated or not?
As Superintendent Stock mentioned, last year, students did come out and would tell us, as many of them were getting vaccinated, they shared that information. And I would assume that would be the case this year as well, especially in our secondary sites.
But that would apply to quarantining.
It doesn't change anything for
It doesn't change
masking.
anything for masking, because
According to
CDPH
this.
has said it doesn't matter if vaccination or not. So in wearing a face covering, CDPH made no distinction, so we feel no need to ask students for that. We only would is if they were in a quarantine situation, it would help them not have to stay home. We would then offer that option.
And when we say ask students for the quarantining, are
Parents.
we? Okay, so we're not pulling a student and saying, are you vaccinated?
No. All that communication through our health services team works to communicate with the family around, and just same we would on any like underlying symptoms and things like that. All that works through the parent as well.
I just want to clarify, the masks from CDPH is a legal requirement. The quarantining is not a requirement, it's a recommendation.
Correct.
Okay, as worded. Okay, I know we're going to have time to talk about that more, so thank you.
Two quick ones. Drop-off pickup protocols, as far as more, I guess, at elementary, everything stays the same as last year and nothing changes with that?
It would be back to standard, really. Last year, we tried to separate and stagger, but we would have standard. I think what we do want to keep, that what people like, though, is having classroom doors open where students can come into classrooms and we're not gathering outside. So some things that we like to work well, we'll keep those, but otherwise, standard.
And then any kind of team stuff, off the field, off the court, I guess same way, as long as it's outside and doing things standard. So the old school team meals, everyone meets somewhere, that's all.
Outside, no mask
Outside's good.
required?
Okay.
We'll be able to talk and deliberate
Yes.
after public comment. We're just
Yes.
asking questions on what's presented to us at the
Yes.
moment. Okay, just clarifying.
Yeah, fair. All right. So we'll open this up, just real quick, we'll open up to public comment. We'll go through, we'll follow the same standards, I'll walk through those in a second, but walk through that, and then after we're through with public comment, we'll come back around for one more session of us talking, I guess, again, based on what we've learned, what we had. So real quick, first, before we start, and if you're gonna queue up, thank you. I have one person, I wanna try to, Heather Winter. Heather, perfect. So RTPA representatives, real quick, I wanted to pull you up first. After, and we'll work through it. After she speaks, we'll go through, I'll give you real quick, and for just board meeting public comment protocol, State your full name, state what school your kids attend or the city you live in. We'll go 3 minutes per person. We're trying to keep it to about 10, 12 people-ish to stay in that 30-minute thing so we can go through and have the comments. 1 comment per person, and then just in general, the board is not permitted to deliberate or take action on non-agenda items and may refer the item matter to a staff member for follow-up. So we'll go through that. I'll walk through a few other things before, but I'll give you the floor. Heather, real quick.
Good afternoon, Board of Trustees and Superintendent staff. I'm going to speak to you just representing the RTPA membership. And I would just want to recognize that it's been amazing not wearing a mask all summer long. But with that being said, we support the side that does keep the students and the staff the safest, following the guidance and policy that's consistent within the K through 12. I personally understand how challenging the masks are. They're not fun to wear or teach in. Yet what the community and non-teaching members don't realize are the very minute details behind the scenes that must be thought about. I mean, they're really silly things, but they affect a lot of different things. Versus just thinking about our little tiny home, friend, or neighborhood bubble, which is where we tend to make a lot of these decisions from, instead of really taking a step back and seeing a much, much, much bigger picture. We are having our classrooms packed very full. And having the unmasked classrooms can present health risks and teachers' absences that hurt learning in a year that will already be full of learning challenges. The attesting to vaccinations creates kind of a scarlet letter scenario, whether you're a student or a district worker. And as the decision-making develops, as RTPA, we just hope that we can be a part of the process rather than part of the results and just hearing about it. We would love, since we are the frontline people, and your decisions are what we have to follow through, that we would love to be kind of more collaborative in that process, because we have to make everything happen. So thank you.
Yeah, just real quick, folks, and I know I got a handful of people, and I super appreciate it. So as we go through, again, full name, city and school where your kids go, I'll have a 3-minute time limit. At about 2 minutes and 45 seconds, if you're still going, I'll just raise my hand and kind of give you a heads up, a 15-second warning. And then after 3 minutes, I'll really encourage you to wrap it up. So if it's a long discussion, conversation, please try to conclude that, in and about 3 minutes. I know we have a bunch of folks from a handful of different sides and different perspectives. Please be respectful of who's speaking. Please be respectful to the board and the audience as far as we're going there. There is always, and I guess all of us up here and most of us in the community, we've seen, heard, read multiple stories and research. So everyone can present, different sides of every argument, and there's always out there. But just please be respectful. Please present off, and we'll go ahead and start with you, ma'am.
Good afternoon. My name is Millie Yan, and I live in Rocklin with kids in Valley View. Our school district is experiencing a budget deficit, so my first point is that if, as you know, federal, state, or local law, regulation, or mandate is intentionally not followed, coverage for any resulting claims may not be available due to the common exclusion of coverage for the consequences of breaking the law. Therefore, to minimize risk, I recommend implementation of viable, strong enforcement options that maintain compliance with CDPH guidance, which is clear as to the requirements for masks to be worn in indoor school settings. Masking is inconvenient, but it is a pro-social behavior that respects the safety of our children who are immunocompromised and who are unvaccinated, and who want to come to school in person to learn. Not masking deprives these children of the opportunity to learn in person. The risks of unmasked, unvaccinated in-person learning will result in increased transmission of sickness and the probability of death. Masking is a way to show caring about life. Finally, I want to remind the school board about the district's motto, excellence in education. Excellence includes making decisions based on listening to reliable sources of evidence, sound reasoning and logic, certain legal and ethical considerations, and some wisdom. When people fail to follow these principles, it is called bad faith arguing. And that is a poor model to display in front of our children. Bad faith controverts excellence. Excellence requires a focus on delivering quality educational services to our students in a safe and healthy environment that maximizes the number of children who can participate in in-person learning. For the rest of my time, I would like to introduce Dr. Terrence Chang, who was born and raised in San Francisco. He did his undergrad at UC Berkeley, medical school at UC Davis, a pediatric residency at UCLA, and an allergy and immunology fellowship at UCSF. He moved to Granite Bay with his family in 1996, and he opened a private practice. Over 40 years, he's been affiliated with Oakland Children's Hospital, Mercy Medical Group San Juan, Sutter Roseville Medical Center, and Kaiser Oakland and Roseville. He's been providing care for kids and allergy immunology patients for over 40 years and is a published medical author. Today, he remains on top of his medical journals and teaches pediatric medicine at UC Davis Medical School as a clinical professor.
Yeah, I have to say, this is a really boring medical conference, but I say it with a compliment because you guys were so engaged and in-depth. I'm impressed with the school board. But I am Dr. Chang. I've had over 40 years of experience also as an immunologist, as an asthma specialist. I heard asthma said many times. But I'm here to represent a community of physicians that have petitioned, if you haven't had it already, I don't have copies, but you can get it, that signed the petition mandating masking if the children have not been vaccinated. We're especially concerned about K through 12. And this would be consistent with the American Academy of Pediatrics. Many of the physicians there want mandated masking until the vaccines are available, which is consistent with, I think, the board member Mr. McDonald expressed too. I've been on the front line and saw children die from infectious disease, from viruses, and you wouldn't want to see that. I don't have to go through the epidemics and stuff like that. My time is limited. But as Placer County, compared to other counties, we've been very, very fortunate, very lucky. I think we dodged the bullet of COVID-19. But more on that later, because COVID-19, as you know from the news, it's evolving into the Delta variant, which is 70% more transmissible. And if you get it, you stand perhaps 2 or 3 times more likely to be hospitalized. God forbid if any of the children in our school district become sick, that seriously sick, or one of the relatives. And that's why we're here, to protect them. Now, as far as masking is concerned, I know that probably some of you on the board here have already, in your mind, cast the vote to be soft on masking, with or without enforcement, or just leave it up to the parents. And those policies would be dead wrong because, like I said, we're looking at a ticking time bomb as we see the Delta viruses coming towards us. And your policies and that you worked so hard at, recommendations, they're going to change. They're going to be changing as time goes on, as these variants are going to be more lethal. I hope not, but I think that's what's going to happen. especially to those that are immunocompromised, that we talked about those children at the schools. If they are exposed to it and they die, well, I hate to say it, but it's going to be on our watch, the board's watch. I'd hate to see any of you carry that burden of guilt or blame, and we all, as a community, will have that blame. Okay, I have a lot more to talk about, but my time is up, and I'm going to honor that.
Appreciate it. Thank you, Doctor.
Hello, I'm Jarita Pichon of Rocklin, and I have a child at Sunset Ranch Elementary. I have been a public health practitioner for over a decade, but today I am here speaking as a concerned parent of 2 young children who are not yet eligible to be vaccinated against COVID-19. I fully understand that parents are tired. I hear the concerns about mental health and wellness, and I too wish to get back to a normal life as we used to know it. I want to start off by saying that I am a proponent of in-person learning, and I see its infinite benefits. I know I'm not equipped to step in for our teachers, and I respect the hard work that they put into enriching our kids each day. However, I fully believe that we can return to school safely by following the new CDC and CDPH guidelines and recommendations for universal masking and other layers of safety like ventilation and testing. Let me give you a few things to consider. Our county's 7-day average case rate per 100,000 people has almost doubled since June 15th, when the state economy reopened. And it's now 2% higher than it was when the regional stay-at-home order went into effect last year. If the original blueprint for a safer economy were in effect today, we would be in the purple tier, the widespread tier, the worst tier. In addition to the alpha genome, we now have numerous variants, including beta, gamma, delta, delta plus, eta, iota, kappa, lambda, and more. I mean, if we keep going, we're going to exhaust the Greek alphabet. We now know that the Delta variant represents more than 80% of the sequenced cases in California, and that it's more virulent than all the other variants. And what about MIS-C? Multi-system inflammatory syndrome in children. For those who don't know what it is, let me tell you, it's nothing to play with. It's a condition that's linked to COVID infection in kids that can cause different body parts to become inflamed, like the heart, lungs, kidneys, brain, and more. The symptoms range from fever, rash, and gastrointestinal issues to things like cardiogenic shock, where the heart can't pump enough blood to the body, cardiomyopathy, or stiffening of the heart muscle, leaking heart valves, or even death. Since most school-age kids aren't yet eligible to be vaccinated against COVID-19, they are most vulnerable for severe illness from COVID and for MIS-C. Cases of COVID in kids and MIS-C are increasing and fast. I don't know about you guys, but I don't want to expose my kids to this, and I don't want to expose your kids either. We can sit here and pretend that it's not going to happen to us, but what if it did? Why take the risk? If we're worse off now than we were last year, I have to ask the board members, why are we considering rolling back COVID protections now? One child in our district becoming severely ill or dying is one too many for me, and it should be for you as well. Thank you.
Thank you.
Hello, my name is Rachel Crutchfield, and I live here in Rocklin. Good to see everybody. And as Derek said, I feel like we can cite all kinds of facts and data, and we can kind of prove either side of this. And depending on who you talk to, masks either save lives or they suffocate our children, dehumanize them, grow harmful bacteria, etc. With all of this conflicting information and difference of opinion, the clear answer for our district is giving parents mask choice. Let parents decide what is best for our children. If you believe that a mask is going to save your child's life, then your child can wear one. If I, on the other hand, believe that the mask does more harm than good in many ways, then it should be my right and my child's right to go to school without something over their mouth and nose. 2 of my kids have asthma. They literally cannot breathe with a mask over their face. And that's why we homeschooled our kids this last year. We know that RUSD can follow CDPH guidelines and develop a mask policy similar to the one that has been drafted by Roseville that states that the district, quote, will strongly encourage all students to comply with CDPH guidance, including use of masks. However, district staff will not be placed in the compromising position of taking enforcement actions. Roseville knows what they can do within the law, and many other districts across the state do as well. Please consider choosing option B on your second slide and not enforcing the policy. This is a win-win. Your hands are not tied. Do the right thing and give parents a choice. The clear answer is mask choice. Thank you.
Hi, my name is Stephanie Wardlaw. I live here in Rocklin. I'm a parent of 4 children that attend Rocklin Unified Schools, covering elementary, junior high, and high school. It's my understanding, why we're all here, that the board's in the process of determining how they're going to implement and proceed with the mask situation in our district. Over the course of the past 18 months, our children have had lots of changes and different things thrown at them, in which most have adapted to them well, some not so much. However, at this point, I believe that families and parents should have the ability to make personal choices regarding their children's physical well-being and safety at school. I believe that it is my responsibility as a parent to govern and watch my child's own health factors, not the school district's. While the school district does have a say in the campus well-being, at the end of the day, I feel more comfortable judging my own child's safety than the school district's. Allowing parents and children to choose allows for less confusion on mask policy and enforcement at schools. I have no problem with other families choosing to have their kids wear a mask to school or not to wear a mask at school. But I do have a problem when I do not have any input on my child's safety on campus. I do not feel comfortable with my child wearing a mask at school all day. So why should I have to make them wear one? But this is not only an issue of a mask or not. What if the roles were reversed and suddenly parents who want a mask on their children were not allowed to wear one? I believe in choice, and without choice, I don't feel comfortable in sending my child to school. Just as you can see in this room, you're all unmasked, sitting elbow to elbow, indoors, but as an adult, that is your choice. Just as this statistics show, our children have a far greater less chance of becoming very ill than any of us in here. At this time, I'd strongly suggest that the board and district put the choice back on the parents and families, whether they would like their child to wear a mask at school or not. Thank you so much for your time.
Hello, my name is Tammy Main. I have raised my 6 children here in the Rocklin School District, and my youngest is 19, and he's in the adult transition class at Rocklin High School campus. Treating students differently according to their vaccine status is discriminatory. There are many different reasons that students are not able to get the COVID vaccine. I have my special needs son who was injured by vaccines as a child, and he cannot receive the COVID vaccine. And it is an experimental vaccine. Why should he be treated differently because of something he has no control over? He has a difficult time understanding why he has to wear a mask and often removes it. Will he be sent home if he can't keep it on the full day? And by the way, he has a hard time articulating his thoughts and feelings. And sometimes they come out as behaviors. Because he's over the age 18, the question is, if somebody suspects that he might have symptoms, will the school notify me before testing him? I am his conservator and his mother first. Thank you for letting me decide what is best for my child. Thank you for your time.
Hi, my name is Gemma Marizzo, and I'm a parent at Breen Elementary of 3 kids. We were in RVC last year, so we have a different experience. So last year, you guys were stuck between a rock and a hard place, and you were really asked to make decisions about how we move forward as a district. I cannot imagine being in your position. Many of you were not on the board yet. I watched these meetings. That was gut-wrenching, and I can empathize how hard that was. But now you're not being asked to make a decision. You're being asked to follow recommendations, strictly, because all children should feel safe on their school campus. The recommendations are clear. And the reality is, nobody is a medical expert in this room. That is no slant, well, there might be more medical experts in this room, but nobody on the board is a medical expert. The CDC, the American Academy of Pediatrics, County Department of Public Health, there are recommendations. It's science, it's facts, it's not debatable. I have to make one thing very clear with misinformation. There are different opinions, but there is not different sides with facts. Like, it's science. And that's what we're teaching our kids, right? So the mask misinformation is that my mask protects you and yours protects me, right? If I send my child to school in a mask, they are not protected. And because they know science, because I did RVC this year and I was in charge of their education, is what it feels like, they actually do know the facts behind mask wearing. They understand, they are happy to wear masks. My first grader and incoming second grader thinks he's a ninja. He is happy to wear the mask. It's because of how I parented him. Like, I did not make this a hard thing. Please err on the side of science and facts, and let's really choose to educate and make decisions based on what we know to be true and not on popular opinion. Thank you.
Good evening. My name is David Brame. I'm the proud parent of an Eagle Scout student, athlete, and musician at Whitney High School, and an honor student musician at Granite Oaks Middle School. To borrow a line from a Kevin Smith movie, I really shouldn't even be here today. In fact, I'm supposed to be at a camp up in the Sierras right now, leading a group of youth on some incredible adventures, not unlike what I've done with science camp for many years in the Rocklin Unified School District. I have seen that moment when a child has gone from can't to can. I have been there helping a student get up Walker Peak and seen what our children can do. But I also experienced, the reason I'm here is because yesterday we came home from camp because 22 of the 40 staff at the camp that we were at were unvaccinated, and one camper who was exposed to COVID-19 caused it to be required that all these unvaccinated staff members leave the camp. Now, these young people, these students of this school district, and I'm not here speaking on behalf of this youth organization or their families, this is my speech and my time. These people, these young people, these leaders in our community missed out on this opportunity because some people chose to not get the vaccine. This was 100% preventable. There was no reason for this to happen. After missing all of last year, after all the sacrifices that we have all made, I hate this mask. And if anybody knows, I don't like to use the word hate. I hate this thing. I want it to go away. I want freedom. But we can't have freedom until we make the sacrifices, until we do the hard work, the other things too that President Kennedy talked about all those years ago to be successful. We cannot get past this virus until we stop drinking the Red Bull energy drink of lies, misinformation, and demagoguery and conspiracy about this virus. It is real. It is serious. There are things that we can do right now to help mitigate it. But we have to have the will. You have to have the will. And if you don't, we are going to have more of our youth, more of the kids that you want to have playing football and sports, sacrificing yet another season. Thank you, ladies and gentlemen.
Hi, my name is Brittany. I am an RVC parent also, along with Gemma, and I am not going to be speaking as eloquently as David, because honestly, I'm quite angry right now. I have a daughter that has a chronic illness, and she basically has what long COVID is. She didn't get it from COVID, but we had to keep her home all year long because I didn't trust the district. And thank God that all 4 of my children had such amazing RVC teachers. They were rock stars. But I haven't heard one of you talk about RVC or what an unviable option that is for our students, for most students. When you say, just go to RVC because someone doesn't want to wear a mask, that's ridiculous. I have spent hours on the phone with the nurses to make sure that my daughter can be in class as much as possible because her symptoms align so much with COVID symptoms. She has a condition called dysautonomia, and it's basically a nervous system condition. RVC made it worse, and she was so sick. She made it through, though, and she got straight A's, just like my other kids, and they did amazing, and I'm so proud of them. But again, I've heard nothing from this school district about RVC, and all of those, over 1,000 students that were in RVC struggling and trying to get through. It is an equity issue. I sat on the equity committee. This is absolutely an equity issue that families that are concerned about their physical health or their children's physical health are being forced to either do some half-ass homeschool or to do RVC, which is, again, not even a good program. It worked for last year. It should not be an option that we are pushing on families this year because families are leaving and they want to leave the moment they hear that that might be what they have to do. I will also address the fact that our district talks about PBIS all the time. At the elementary school level, are you going to wrap that up into the PBIS program to address the bullying that's going to happen for the students that are doing the right thing and wearing their masks? How are you going to address that? How are you going to address the bullying at the high school level? My son didn't come here today because he was bullied and mocked so much by his sports team because he followed the rules. He wore his mask every fucking day. Yes, every day, and no one enforced it. And I'm sorry, but I'm pissed that my son is afraid that he is going to be mocked and bullied by other high school students if he comes and speaks up. Thank you.
Good afternoon, trustees and Superintendent Stock. My name is Diana Watkins, and I'm the parent of 3 students, 2 of which will attend RUSD schools in the fall, 1 at Whitney and 1 at Springview. Rocklin Unified and many of our trustees prides itself on seeking stakeholder feedback, yet this meeting is being held on a Tuesday afternoon when many parents and district employees will have work and/or childcare conflicts. Public comment is limited to only those who are able to attend in person. If Rocklin Unified, as well as its trustees, truly want stakeholder feedback, we need to make it easier for all stakeholders to participate and submit public comments, not harder. Over the last year and a half, I've watched interactions within the RUSD community grow increasingly more contentious and divisive. You see it tonight in how people are sitting. My family has been a part of RUSD for 12 years, and this is heartbreaking. I've also watched what is happening in other area school districts, and they don't seem to have nearly the level of animosity or vitriol that we are seeing in Rocklin. I think that this is due in part to the way that RUSD has navigated public health guidance. Rocklin Unified and a lot of folks who have no background in medicine, public health, or communicable diseases seem to spend a lot of time discussing specific health directives and whether or not we are going to follow public health guidance at all. In other school districts, this seems to be a non-issue. They seem to accept and follow public health guidance and focus their energy instead on providing the best educational experience for their students in what I think we can all agree are challenging times. We know that there is learning loss for our students from the last year and a half. Our teachers and staff members are still recovering from what has, for many, been the hardest year of their professionals and maybe personal lives. Instead of spending our time arguing about masks and whether or not we should follow various public health directives, I'd ask that RUSD, as an educational institution, respect the guidance of doctors, epidemiologists, and public health experts, and follow current public health guidelines from CDPH and CDC, and let's put our focus back on education. A common phrase I keep hearing to not follow public health guidance at our school seems to be, if you don't like what's happening, you can take your kid to RVC. This cannot be our response. I fully support Rocklin Unified's goal to get their students back in the classroom for in-person learning. After a semester in RVC, my 3 boys will all be back in the classroom this fall, and we're all very, very excited about it, except my youngest, who will miss his time in his pajamas. RVC's program is a very, very hard way to learn. I don't know many people who learn well by watching pre-recorded videos with no access to live instruction. While RV serves a purpose, it is no replacement for the live instruction a student receives in the classroom. And Superintendent Stock, I have to take issue with your statement that we had all kids on campus last year. You had 1,600 kids in RVC who were not on campus. If my children need to wear masks to allow more of their fellow students to be able to attend school in person, this is a very small inconvenience for them that makes a very big impact for someone else. Please, let's show some respect to the medical professionals and scientists who have devoted their professional careers to keeping us healthy. Let's follow current public health guidelines and put our focus instead back on educating our children. Thank you.
Hi, my name is Kate, and I represent the Placer County chapter of Moms for Liberty. We have 75 chapters in 25 states, with hundreds pending. We are advocates for parental choice, mask choice, and medical freedom. My family lives in this community. We serve as foster parents in this community. My husband treats patients in this community, but our children do not attend school in this community. I am a credentialed school teacher, but I am at leave on home to home educate our 2 children because they have been denied a public education in California schools because of medical segregation. CDPH may have the authority to enforce mask requirements, but schools and teachers do not. Please do not allow the CDPH to make your teachers be the bad guys. Teachers and school administrators are not police officers hired to enforce laws. The guidance from CDPH isn't even a law, it's a guideline. Students cannot be excluded from school for not following a guide. Do not do the dirty work for the CDPH. Do not require your teachers or staff to bully kids into compliance with threats of segregation if they do not comply. When teachers are allowed to segregate kids in their own classrooms and treat their students as if they are sick, contagious, and a threat to their fellow classmates by spacing them out, this creates a hostile learning environment, feelings of uneasiness and fear, and pressures students to keep spacing at the forefront of their minds, not their education. If they can sit shoulder to shoulder at an assembly, they can certainly sit shoulder to shoulder during circle time. Please require consistency across the board, so students should not be required to space out simply because a certain teacher prefers it. Vaccinated versus unvaccinated. Treating children differently based on their medical status is unethical. It is segregation, discrimination, and a violation of their rights to equal treatment under the law and their right to education. Requiring evidence of vaccine status is unethical and unlawful. School personnel do not have the right to require proof of vaccine or obtain knowledge of a student's health status. Students should not be treated differently or quarantined longer, punished, or excluded from school because they are minors. Many do not even have a say or a choice as to whether or not they are vaccinated. It is a violation of their right to equal treatment under the law. If you can't legally require your adult employees to approve vaccine status, then it only makes sense that you can't legally require your students to show proof of vaccination to prevent them from being segregated. You guys just clarified just now that a quarantine is not a legal requirement, so therefore you are not liable for enforcing this civil rights infringement on your students. There seems to be a lot of concern about legality and liability and insurance coverage, but there are no safety studies proving that it is safe for children to wear a mask for 6 to 8 hours a day. Where's your concern about lawsuits from injured children who suffer from oxygen deprivation, skin lesions, and breathing in high levels of CO2? I have more to say, but my time is up and I will be respectful of that. Thank you.
Hello, my name's Kelly Tajiri. My kids attend Whitney High School. I'm submitting this letter on behalf of myself, Children's Health Defense, the California Parents United, and the Protection of the Educational Rights of Kids, which are nonpartisan organizations who advocate for children. I'm writing this request that the school district follow the new CDPH guidelines and develop a policy for Rocklin that will limit the enforcement of mask wearing by children. Sufficient enforcement can include posting a notice, sending a letter home, discussing with the parents regarding the risk and benefits of mask wearing. Rocklin Unified School District can allow parents to decide and follow the CDPH guidelines. If a school or agent of the school, such as a teacher, enforces mask wearing and it adversely impacts a child in any way, but not limited to psychological damage, physical harm, or impending academic progress, then the school could be civilly liable by law. Schools are not even allowed to use a physical restraint technique that obstructs pupils' respiratory airways in the first place by law. In event there's any doubt that the actual risk of harm to a child exists, in the event they are forced against their parents' will to wear a mask by a school district employee, I respectfully direct you to the complaint filed against the Los Angeles Unified School District on July 19, 2021. The list of physical and other symptoms is long, and it includes increased stress hormone levels, muscle tension, loss of concentration, loss of reaction time, long-term neurodegenerative diseases, hypertension, premature aging, fear, mood disturbances, and the list goes on. Clearly there is risk, and now school districts across California are on notice of this liability. Considering the foregoing, the respectful recommendation is that the Rocklin Unified School District and school board members immediately create a policy for all staff to encourage mask wearing without denying educational rights. The district could adopt a process of dealing with a student that attends school without a mask as one of education. A call could be made to the parent to confirm their directive and discuss the benefits and risks, or a letter could simply go home to the parent to encourage reconsideration of their decision. This would respect the CDPH guidance, relieve the district of liability because the ultimate decision would be the parents, and comply with any individual concerns over mask choice as an option. In conclusion, I respectfully request that you immediately develop a policy that encourages, educates, but limits enforcement of masking children. Please have courage to do the right thing for our children.
Hello, my name is Corey Comstock. I also have kids at Whitney High School. My only purpose here today was to say, you know, you guys do have a tough choice, and it's actually something new, right? We never had to talk about masks in school prior to last year, and it's going to come up future years, you can guarantee. So just know that I believe masks should be a family choice, because these are here to stay. They're not here this year, last year. It's going to be next year. There's variations, as the doctor attested to. There's a lot of variations. There's going to be more to come. So please, I'm urging you to err on the side of family choice for masks. Thank you.
Hi there, my name is Dawn Gore. I am a parent of 3 kids in the district, 2 at Granite Oaks and 1 at Rocklin. My oldest has been in the district, or they've all been in the district now, since they were in kindergarten, so 10 years. So I've actually also been lucky enough to work in your district as a substitute, a long-term sub, a PE aide, and have been in many of the classrooms throughout the year. So I'm very familiar with the school, with the district. I've also lived in the community for 22 years. My husband works in the community. I'll withhold on what he does, but anyway, we are very familiar with the community. We love the community, and the reason I'm here is because I love my children too, and I believe that the right choice is to let parents have that choice of what they want for their family, what they think is best for their student. Also, so I said I've been a teacher in the Roseville Union School District. I've also been a teacher in the Roseville District. And I am currently a teacher at a charter school in Western Placer. As a teacher in that charter school, I have students K through 12. They're homeschool students. I chose not to put my own students in that school because my students thrive in the social setting. So as somebody mentioned here, RVC was not an option for us either because they need that social setting. I have always believed as a teacher that half of an education is social. It's academic, yes, but it's learning how to interact with students. Not only to understand other students, but teachers as well. You can't get that in RVC. And I feel for those students of my own students who are doing homeschooling, but they have their own reasons, health, whatever it is. Anyway, I have 32 students K through 12 currently. Out of those 32 students, 8 have some sort of mental I wouldn't say disability, over the last year are now in therapy for anxiety or some sort of mental illness. And I strongly believe, having known these children and these families for several years now, that it was brought on by the whole COVID situation, masks, social distancing, all of that. I also wanted to mention that Superintendent Stock mentioned that earlier that hydration wasn't an issue last year. However, my own children told me that in the class, they weren't able to drink water because they can't bring their masks down to take a sip of water. They were told they had to walk outside the door, and they weren't going to get up and disrupt class and be embarrassed to interrupt class. So they did not drink until lunch. To me, that's a problem. That's a health issue. I am urging you to go along with Roseville Joint Union School District's position on enforcement and let the parents decide. That you can recommend it, but not enforce it. Thank you.
Hi, my name is Robert Dodge. I'm a Rocklin resident for a long time, and I have 2 kids in Rocklin schools. And I started thinking, why do we have a local school board? Why do you exist? And it's to represent the local community. And we were here a month ago, and you all signed a letter saying we would like local control and the local ability to do and to make this decision. So you've been given recommendations, and you've been given recommendations to recommend, but the guidance of how you enforce is up to you. So I encourage you, make the decision to take the soft side. Let the families decide how they want to have their children's faces covered. I heard some people talking about, well, if just one student, and that argument is so difficult. Like, I looked up this morning what the CDC said. As of last week, 323 children have died from COVID-19. And that seems like a lot, but we're in a country of 330 million people. And in 2018, 643 died of influenza. Like, we cannot let this go on forever. We have the Delta economy plus variation, and we're gonna have the Kappa, 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 and the Psi Beta Gamma, or whatever's gonna come. This is not going away. We can't wish this away. Students, people under 17, do not face substantial harm by this. Adults and teachers have the ability to get vaccinated. There are no externalities. We can let the families decide what they want to do. Let families decide if they want their child to wear a mask, go right ahead. But we want you to take the local control. And I know I say you represent the community. And the people, honestly, that show up to a school board meeting in the middle of the day may not be the best sample of what the community is. I invite you to go to Costco right now and see how many people are wearing masks. Head down to the Walmart, and you'll see that lots of little kids are running around because parents have that choice, and none of the little children running around at Costco are vaccinated. We've taken the decision upon ourselves. We've weighed the risk. That's what life is. Half my senior class in high school got mono. There's risks to going to school no matter what. There's risks traveling to school. Life has risks. There are low risks for COVID-19 for people under 17, and I am asking you to please keep the soft enforcement of just here with the recommendations. Walmart puts a little sign out front. Do something similar. Thank you.
Hi, my name's Kurt Weidman. Live in Rockland, and I have one girl in Valley View, and the other one was in Valley View. We took her out last year because it wasn't working for her, and we're thinking about putting her back in. So this is right. This will go into our decision on whether you'll have 2 of our girls, or 0 of our girls, or 1 of our girls. So I mean, it seems like every year we have to go through this. The Rocklin Unified School District is a local educational agency. You can follow the guidance, or you can not follow the guidance. CDPH guidance is not law, so whatever attorney you're talking to or your insurance carrier, that they know that. So it's not. The exception was the school district has to follow the law. That's true. Always been true. Will be true after the zeta derivative, or the beta derivative, or anything like that. Really, the current facts, we still haven't had one single child under the age 18 in Placer die of COVID. 90% have been over the age of 65. I would think 90% of the school district's employees are under the age of 65. Masks do not stop the actual virus from going through. It can permeate the mask. Everybody knows that. Dr. Fauci has explained that. If there's no studies that have been done with school-age children on effectiveness of masks, we know some of the feelings that kids have about masks. My daughters have stood up here and explained that to the board, and so we know kind of the downside. But I think parents are not going to put their kids in play. They're going to do what's best for their children. They're not going to send them into something that's dangerous or that could harm their health. And every parent's got a different situation with the health situation of their kids. What I would like to do is, I think the district supports equity, and everybody should probably shake their head like this, right? Because that's a catchphrase. But if you're allowing labor unions and school district employees to self-attest, why are our students a second-class citizens? So you really have to answer that. Why do you have 2 sets of rules? Just want you to marinate on that a little bit. So the self-attest option, where you self-attest, the parent would self-attest that they have the vaccine or they don't have the vaccine, should be extended to parents and students. And I think it should still be available for choice to wear a mask, to get a vaccine, to do RVC, and all of those other options too. So I think I am out of time by 3 seconds or 4. Thanks.
Hi, I have 2 students in the district. One is entering as a freshman at Rocklin High, and the other is a 6th grader at Twin Oaks. I'm also a teacher. I don't teach in Rocklin, I teach in a near district. But I got to be in the classroom. I got to see kids in person wearing masks. And I know everyone wants in person, but I don't know how many of you know what it looks like to have a child in class with a mask who is coming in from recess at dirty, it's fallen on the ground. I had one little boy, because it's 1st grade, so we're reading, and he was really frustrated, and I couldn't even tell he was frustrated until the tears were flowing and his mask was soaked, and I was like, "Hey, buddy, what's up?" And he's like, "I just don't get, I can't." And I'm like, "Oh, no, we'll go over this." He goes, "No, I can't breathe. I need to go in the other room. Can you let me go?" And I wasn't sure what protocol was at that point, but I was like, I can't let him, what do I do? No, sorry. So I watched this little boy get up, run to the back of the room, and just take his mask off and breathe and breathe and breathe, and then come back, get his composure down. I saw that every day for 180 days. It's painful. I also watched my kids plead with me. I had distance learners zooming into class, and I also taught in class, but I had my kids in class with masks beg me, "We want to see your face, Mrs. W. Can you please show us your face?" So after school on Friday, we called it our Hangout Friday, and I got to Zoom with all my kids. They didn't necessarily like the Zoom part of it, but they could see my face. I could see their faces. They had their brothers come up, their kitties, their doggies, even a grandparent. It was so invaluable to have that connection, and that has been missing. I've been teaching for, going on almost 30 years, and I've never, of course, been in this situation, nor has any of us, but to see the lack of excitement about school, it just felt like a chore to them. They were still excited to see their friends, but then I'd watch them after school. We had a short day, 8:30 to 12. I'd walk them out to their parents. They'd pull off their masks and run to the park, and like groups and droves of kids are like, can't wait to see you after school, and we have a sleepover tonight. And we did our writing. It was like, oh, I went with my friend on a camp out with 10 other families. And it was like, so it just was hard for me. It was hard for me to see that I was put in a position to do something it was just hard. It was hard for my own kids to see them suffer, but to see these kids every day that weren't my kids, but will always be my kids. One other story, for recess, they got to run around for about 15 minutes. So one of my little students, I look over and his mask is off, and I'm like, hey, buddy, why don't you go play? And he's like, no. I'm like, it's your time to run around. He's like, I can't. I have to wear my mask. I just don't want to wear my mask. So I'm just going to sit here. So I called home and checked, and I said, I don't want to push him, but and they said, nope, if he wants to sit there and watch without his mask, let it be. So moving forward, can we make decisions that let us parents decide, I cannot watch these kids suffer anymore? Thank you.
Hi, my name is Hope Struck, and my kids are at Breen Elementary School. I have 2 children. They're going into 6th and going into 4th. But I'm here today to read for a parent who was working. She writes, it is so concerning that masking in schools is even a topic of discussion for RUSD, given what's going on around us with the Delta variant and more. I have to ask the members of the board if they have really thought this through. By purposefully going into the new school year without COVID protections in place, you are choosing not to protect our kids and our families. It's like being on a sinking boat and choosing not to use a life raft on board because you think you're an expert swimmer. We are only as strong and as immune as our most vulnerable students, and we need to be exhausting every precaution we can to protect them. By choosing not to protect our kids, you are accepting responsibility for whatever the outcome is. If a child becomes severely ill or, God forbid, dies from COVID, there could be medical, legal, religious, or even personal consequences for you if you choose to ignore the state and federal guidance. Is the district prepared for this? Are you all prepared for this? I would like to highlight that hosting these meetings in the middle of the workday prevents the majority of Rocklin parents and community members from being able to attend. Additionally, most people who have a sound understanding of the risk of transmission of COVID-19 would not attend an in-person meeting in a crowded, unventilated boardroom. It contradicts all medical expertise, guidance, and data that is provided to us. Disallowing public comments by virtual means that those individuals are forced to either choose to endanger their own health for the greater good or watch the live stream and not be heard. This sets us up for a skewed representation of the beliefs of our community. We have a variety of options in Rocklin, and we want them to be represented here accurately. And then on a personal note, I just want to add that the school board you are a group of leaders. You're leaders in our community. And sometimes leaders have to make choices that aren't popular. I know that there's a lot of people here who are scared for their kids. I feel like we actually all have a lot in common. I hear that we love our kids, and we want them to be safe, and we want them to be educated. So I just would urge you to make it simple and follow the guidelines. And then, even though it is hard to wear a mask, at least we're erring on the side of science and the data we have and being in compliance with the state. I know it's difficult, but I'm asking you to not necessarily do what is popular, but what is good leadership. Thank you.
Hello. Just real quick, so be yourself, and yeah, you'll be the last one. So cool, thank you.
Hi, my name is Lisa Barker, and I live in Rocklin, and I have 2 grandkids at Antelope Creek, and I'm here representing myself and my daughter and her husband. We all would like to have, sorry, I'm nervous, to have a mask choice. My daughter is an ICU nurse at Sutter, and she has seen people die from COVID. It's true. It's a real thing. But these are people over 70 years old that have underlying health issues, and this is what we've heard, you know, that this is what's happening. Our children are not getting COVID. I don't know why we want to do this to our children when they're not even getting this disease. They are getting the flu, they're getting other things, but they're not getting COVID. I don't know any children that have gotten COVID. I do know adults that have gotten COVID. I don't know any who have passed myself, but I have a friend who lost a niece, so I know, you know, it's very real. It is real. But from what my daughter tells me, the cases have gone down, down, down. And I just looked up the Placer County Health. I looked at the graph, and the cases are down so far, I don't know why we would even be having this conversation about having to wear masks. My grandson is asthmatic, and I believe he had a bad case over the winter because he was wearing a mask. And my daughter, who's a nurse, believes the same thing. Those masks are dirty and they're disgusting. So that's what I believe, and I just hope you'll listen to as parents that would like to have a choice. Thank you.
Hi, my name's Shannon Catanella. I have 2 children in Rocklin Unified Elementary Schools. I know everything's pretty much been said. But I'm stumped. I'm stumped while we're here after the doctor spoke, to be honest with you. I'm stumped that we're all still talking. Because he's a doctor, and none of you are. And all the studies that you're quoting have been retracted. So the carbon dioxide, I'll speak to you. The carbon dioxide study that was put out was done by a psychologist. It was research. It was retracted. It was a psychologist. It's incorrect. There are several studies that have been retracted. The reason these children have dirty masks is because the parents are not purchasing clean masks for them. I think that the kids, if they drop on the playground, go to the nurse and get a new mask. They're disposable. I am in favor of universal masking because I am in favor of protecting all the children. I am in favor of getting back all those RVC families that had to stay at home. The parents had to leave their jobs for the entire year and teach their children. They're exhausted. And I think that none of them, well, we've got 2 of them here, but they're brave because I talked to several of them who weren't willing to come into this room of unvaccinated, unmasked adults who are already breaking the state mandates. So that's fine. You guys can take whatever you want into your own hands. You guys can take your masks off, and the Delta variant is coming, and I understand that we don't have cases of children here, but that's because it hasn't gotten here yet. I think you need to go back and listen to the doctors. I think you need to talk to virologists, immunologists, the health department at the county. I also need to say 2 things. In our handbook for the entire district, under safety, the superintendent or designee shall establish regulations and procedures as necessary to protect students from dangerous situations. My feeling is that asking a child to wear a mask is not a dangerous situation. Having the possibility of a child catching or contracting or sharing COVID is a dangerous situation. The doctors say so. The other thing is my school has these expectations, they call them. The 2 are stay safe. The other one is make responsible choices. So I urge you to stay safe and make responsible choices, and I will share this as parting. I was in Monterey this week. I went to the Monterey Bay Aquarium. They require masks. We were there for over 5 hours every day for 5 days because. And everybody was fine. Monterey Bay is packed with kids. Everybody had masks on. Nobody had a problem. Nobody passed out. Thank you.
Hi, my name is Gina Stone. I have a daughter right now going to be a sophomore at Rocklin High School. My son, I guess you could call it, graduated last year from Whitney High School. It's obviously been an incredibly rough couple of years for everyone involved, and I second whoever had said I don't envy your all positions. I did not plan on coming up on talking, but I felt there was something that wasn't being said that I wanted to make sure was a point I am for mass choice. I believe that it is an American way. It's our choice as Americans to choose how to handle our kids and their safety. One thing I've noticed with my children, my daughter especially, being that she's involved in this mostly. My son was a freshman last year, and he was in Alabama, so it was a different situation. But the mental stress that it has put on young teenagers in the last year or two has been very incredible. I know a lot of kids, teenagers, they do that devil of social media, and it's horrible for them. Not having that social interaction and being able to see each other's faces and see each other caused them to go there even more and have more time on that. And the other thing I've seen that is really sad to me is the lack of focus on college in our high school students since this all happened. A lot of students have turned to whatever. Some of them are deferring a year. They're not even planning. My daughter, we had planned a trip to go visit colleges. She's not even interested anymore. I'm pushing it, obviously, but it saddens me, and I think the biggest reason is their lack of focus in school, their lack of importance in school, and as someone else had said, school for children, especially in high school, a social is a huge part of that, and when the social aspect of school is taken out, it becomes a very unimportant thing for them in their lives, and they're turning to that social media and college, and their future is not becoming as important, and that makes me very sad. I've seen a lot of very, very intelligent, amazing kids not take their future seriously this past year, and I see some in the future dropping that as well, and that scares me. So to help these students push towards their future and stop living in fear and start living for the future instead of just getting through today is what I'm advocating for, and I hope you all can get through the next few weeks. Thank you very much.
So real quick, folks, we'll take, so I'll go. Just give you two minutes real quick. And just, no, 2 minutes. One person, 2 minutes, and we'll go, okay? Good. Go ahead. 2 minutes, go.
I can do it in 1 minute. I just wanted to share that I saw some people here with masks, and I saw them, observed them adjust their mask and, do normal things like put on chapstick or adjust or itch their nose. And my children don't have that luxury. They don't get to rub their nose or put chapstick on. They don't even get to get a drink of water because they're afraid. They're afraid. There's a culture of you must obey that is beyond compare. These are little kids. These are children who listen and want to please. And that, like my daughter, she comes home thirsty because she's like, I can't have a drink of water. I'm afraid. No, Mom, I can't do that. No, Mom, I can't do that. So I just can't express to you, prepubescent children are not passing COVID. They are not passing COVID. It's not happening. Please don't put masks on these kids. Please don't do it. Thank you.
All right. Thank you, folks. So, that concludes kind of public comment for this. We're going to take a quick 5-minute break, a recess, and then we'll come right back, and then we'll conclude the rest of the conversation. So thank you. About 5 minutes, folks. great comments, got different stuff. Is there any questions, conversation, deliberation? And I'll just kind of open up the floor to the folks here.
I'll jump in on one piece that's not necessarily CDPH related, but I thought a good talking point for us while we're talking. Oh, can you hear me? Is that better? There? Okay. I have a pretty loud voice. No, you know, I heard multiple comments about this, and I don't know about you, but I received a ton of emails, phone calls about, whoa, why a meeting right now in the middle of the day with limited notice? And so I totally understood that, right? I think myself, I was a little confused at first, like, wait, why are we doing this? And I think clarity on the study session, the desire of the board is to hear more information before we make big decisions. And these are big decisions, and I don't think any of us take it lightly. And so I wanted to thank the team here that put the time into this to do a lot of the research for us. But I also wanted to assure parents, this is not normal protocol. This is not something we plan to do every month. But we had some big things that we felt we needed to give an opportunity for us to hear from our administration before we made some big decisions come August 4th. And so I did want to throw out an idea and kind of see what you guys think. I know we don't anticipate special meetings in the future. I know we don't anticipate having to do kind of what feels like last-minute study sessions. But in the event that we do, because I think somebody mentioned something, and it resonated with me. We've learned a lot through this last year, and we've learned that things can change in one moment's notice, and we might need to hurry and meet and talk and discuss these things. So I wanted to throw out, in the event that that happens, could I make a suggestion or a request that when we schedule a special meeting or a board study session that is not on the regularly scheduled calendar, the annual calendar that we've already approved, that we try to get it out on our social media platforms immediately, like as soon as we know, and if not, at the latest, the day it posts to board docs, so people know and aren't kind of questioning, asking each other what's going on. And maybe even look at the option of sending out an email or a robocall to families, just so that way they're aware. And I know this one was the intent for us to dialogue, but maybe explaining that to them. So I don't know about you, but I got a lot of people that talked a lot over the weekend, and by the time they got to me, they already had this preconceived notion of why we were meeting, and man, I would have loved to just explain it to them sooner. Thoughts on that? I'm really just talking to you guys as colleagues when we have to do something like this again, because it may happen. We might get new guidance. How do we want to go about special meetings? And transparency, I think we all want to have with our community, and I don't think we did anything that wasn't transparent, but I want to just reassure our community that that is a desire of us as a board. What are your thoughts on that?
Roger, when did this go on the website?
This was posted on Friday. The agenda was, and then on Monday morning we moved beyond the normal notification at our board meetings, and you find the agenda, which folks did. We also put up the kind of banner on the front page Monday.
Yesterday.
Website. So what we did is on our normal, anytime we have a board meeting agenda, we post it to our website. This board meeting agenda was posted on Friday. And then so we know people were finding the meeting agenda and seeing it because we all got emails. And then in order to make sure it was easy to find as possible, we put a notice on the front of the website that didn't require you to go under the board tab, click on the agenda, do that. Yesterday, right. So that was done there. And
what are our thoughts on, I know in the past we've put little blurbs out on social media, just on Facebook. That doesn't reach everybody, but it's one of those. I'm just thinking those, I know a few people said, man, I checked every day. I checked on Thursday, there was nothing there, and then Friday it showed up. I didn't check Friday. I could hear that heartache a little bit of, do we have to really check every day?
Yeah, no, I think there's multiple avenues of communication. I think our default is always the website, which I think in normal practice is good. Hopefully we don't have many more of these, but I could see, at least on our RUSD webpage, just a quick blurb, special meeting, topic, date and time, and let it go. Maybe once we kind of set this format up and we said, hey, here's the date that works for us, maybe a day or two after, just to give some heads up. We always have, and we always have you can always log in and watch from home, which is great, but just to provide, I'll call it the website and the Facebook that we have, it covers. We're not gonna, I don't wanna do Twitter, I don't wanna do robocalls, to me, I don't wanna put in the
Derek,
newspaper.
we're doing Instagram. We are.
Wouldn't an email be easier, though? Because Instagram and Facebook and all those things, not everybody is on there, but an email would go, could we just do a district email that goes out to the parents? That's not hard, is it?
I mean, we can do anything the board requests. If you say send an email, if you say post something on social media platforms, we can do that. I think Mr.
One thing that
Desange
I think we
wants to-
really need to do a better job of is communicating to parents, because this conspiracy theory thing kills me in that, what is a study session? Oh my goodness gracious, they're doing something, right? And so what is a study session? We have these in the afternoon. I've been here almost 2 years. No one has ever come. I mean, maybe we've had 5 people speak, right? Like to have 50 people here. So we have study sessions. This is what they look like typically. It's us sitting here trying to understand something and get better understanding so we can make choices. Something like this was sensitive and people really care about it. So I agree with you, probably could have been better advertised in the future. And also we need to communicate even amongst staff. I mean, I had teachers emailing like, hey, what's happening? What is this study session? Versus we don't vote during a study session. And so that's another thing that we want to be really clear about. I know President Counter said at the very beginning, but we could probably include that in our communication to families. This is what we're doing and why, and this is what it'll look like.
It's funny, I always remind you guys to turn it on, and now I can't turn it on. So one thing I would add is that our staff newsletter and our families newsletter would be a great place to notify families. There is a special board study session that's taking place this date, this time. No decision will be made. And the first one will go out later in the second half of August, but to accompany that, we could also do social media. I'm a little concerned if we do just a blast email that it might become desensitized when we do send out mass email communications about big topics. And I really want to use that for very big items that we do need to let people know about. And I'm not saying special board sessions are not important, but exactly.
What are your thoughts if it was just for something out of the norm? Like, I'm not thinking I think people know where to go to get the normal ones. I'm thinking, it's pretty rare. I think in the last year, there was only really one board meeting that actually changed, and then a study session was added. Is that?
Correct. And so, for example, the board's going to hold a study session next Wednesday afternoon for 4 topics. And it's, and there's no action being taken. It's to talk a little bit about math improvement goal, the learning loss goal, the opening of Quarry Trail, and kind of the board meeting calendar of major events for the year. So non-voting items that would be of very important, but not of controversy important. So, something
and I'm
like
with you, Archie.
that.
Maybe it's just something, like you said, we're gonna have a study session, here's the topics, non-voting, like real simple, and you're done. And I guess people could come and present or ask questions because we're gonna open it up, but realistically, I don't see people breaking down the walls to talk about math curriculum, though I like it.
No, absolutely. And so I think one sense I hear is if there's something that's not on the normal schedule, so that being a distinction, like we have several board study sessions calendared for the year, and people know and they know to look for it. So I'm hearing if there's kind of something that's out of the ordinary and it's a special meeting or a study session, we think that we ought to notify folks. If there's a special closed session, which is not open to the public, then that wouldn't cross that threshold, because occasionally we need to have those, but they're not public discussions. So if that's the threshold of anything that's not calendared, to send something out via different platforms explaining what's being considered and if it's voting or not, we can absolutely do that. And then that may be a piece like in the newsletter and pieces that Sandeep's starting up is maybe we do a little piece around what's the difference between a study session and a regular meeting? What's the difference between, you know, that kind of thing, so that people understand. Right, exactly. So we can put a, you know, a piece in there to explain that, and I think the community should know that there's oftentimes you all want to go deep into an issue, grapple with it, and it's not just a 30, 15-minute item, but you want to go deep and really understand, and that's, the board does that. That's part of its work in governance. So we will work to implement that for if we have the next time we have a special meeting, regular or study session that's not on the calendar.
Thank you. I think that I just want to reassure those out there, right, that that's our intent here. And I love that we get a chance to have a study session and really talk and throw things out and say, hey, I'm just talking, I'm just asking questions, so that way we're better prepared when it comes time to having a meeting. Also, just a thought of assurance for the community too. The intent of study sessions during the day is so we can meet with our colleagues during the day, right? And not have to bring you in another evening. But I haven't heard any change or plan to not have future meetings in the evenings. We do understand that many parents were unable to come today. That's our study sessions are typically during the day hours, so we can meet with our staff and ask kind of where you're at, what you're thinking. So I just wanted to reassure those out in the community that reached out and were very concerned. Because you're right, there are sometimes these thoughts of, wow, we work so hard to be relational with our community. The last thing I wanted to do with a study session is make them feel like we don't want you here. We want everybody here. I just know it's probably not going to be a lot of fun for other people when we spend a few hours getting into the nitty-gritty.
And I think the only thing I'd add is sometimes we look at a board meeting agenda, or we can anticipate a lot of interest. So the other option is if we didn't start earlier with some items in the afternoon that we think may be more informational, not being voted on, means the board could be here till midnight, 1, 2 in the morning. Not that that's ever occurred, but we could be, because those items typically go at the end of the meeting, and it's really hard for that. So in order to have full attention and just kind of awareness, we've sometimes moved those types of items up before the regular meeting, so that we don't have an extended at the end because they're not being voted on. And so that's been a practice that we've done. Say maybe you'd have a 4 o'clock study session on, say, an LCAP when we're just updating, it's not being voted on. So that's a mechanism that that the board has used that I think does serve well to allow meetings not to go very extended. And then there is no access for folks because they need to sleep, to go to work or school.
Is the right-hand column going to go out to families or be posted on the website?
This document is the intent of the board is to have an action item brought to it on August 4th to vote on around how the district will be implementing guidance. Per our practice, we would be posting a document like this with that agenda item, so the community, everybody's aware of what the board is considering to take action on. So this actual document, the hope is that through this conversation in discussion from the board, it will give guidance to staff on how to prepare a document for the board to consider. And so something similar would, but it would, you can see there's a working document, there's a date on it, that would be amended.
Okay. So, and I guess just to clarify, and with that process, can we have a general statement at some point, probably in the beginning, that says, something like, unless otherwise noted in here, your school, your kids, whatever, goes back to a quote-unquote normal fashion? Only reason I'm trying to ask is I'm trying to avoid that it wasn't mentioned here and I don't know. So Dr. McDonald, can you tell me what this is? So. Whatever, yeah, so if we can, something as simple as it will look like a 2017 school year unless it's physically documented in here somewhere, just so that it avoids us and it gives us that opportunity to say, well, because I don't want to negotiate everything at some point.
We will, and then we'll also invite folks that need clarification to reach out as well, because we'll try to put the drinking fountains in, but there will be a lot of things. Oh, you didn't mention that, so therefore, check with us, but we can definitely put something out that reassures people that things are much more back to normal.
That sounds like a really easy one to start with. So I'm going to start with drinking fountains. I would prefer that at the high school, those kids have access to their drinking fountains. I have teenagers. 4 of my kids are teenagers right now, and they can totally use a drinking fountain by themselves and keep their germs to a minimum. I myself purchased water bottle filling machines for the high school on my credit card because I was parent club president at the time. And my kids fill their water bottles, and we are going to go back to a full day, all day. We're going to have hot days, and they would drink through more than one, right? And we have PE, we have good reasons, I think, to have kids have access to the water bottle filler stations. In fact, do we even have, Craig, do we even have any regular drinking fountains at Rocklin? I think they're all water bottle filling stations, right? And then what about at Whitney? There are regular water fountains. Okay, so maybe, how would you guys feel about junior high and high school, secondary kids are able to use drinking fountains?
Always the thing of this, there's something
Don't like
uncomfortable
drinking
about, no, there's something uncomfortable about us making this decision that seems so in the weeds of what is, so the board deciding where we're gonna have drinking fountains just seems not our role.
Okay, so you would
I don't disagree
suggest
with
that.
you there. I'm okay. I don't disagree with it at all, but I think it's okay to say we love it, but I just don't think we should vote on whether we think drinking.
Oh,
fountains
I
are a good
definitely
thing or
don't
not.
want to vote on it. I'm just giving. Yeah. I don't want to add it to the document or anything. I'm just giving my opinion because I thought it was an easier time since he brought up drinking fountains. That
I think, are you saying, we're not adding this to a document
No,
for
no.
August 4th? You're
Yeah.
simply saying to administration, hey, could you revisit the idea of drinking fountains for junior high and high school? Is that what I'm hearing?
and their water bottle
I would
filling
agree with you
stations
on
at
that.
least at one of
I
our
want to allow our
campuses.
administration to make that decision, but I think we heard a little more tonight. And I think that might have been some new information for administration to have heard tonight, to go, hey, let's maybe just rethink that and think, is there a way that we can make that happen?
I hear you.
What would assist staff, if it's at all, is if we could walk through each element and then hear the discussion. That way we can work through this, because we're thinking, since this document's been discussed publicly, this is a good document to use for the board to have, for what they'll be voting on. So if it's possible to work through these, that would be helpful. We can come back and discuss.
Are you wanting our opinion on each thing? Is that what you're?
If there's nothing, like say it's on, hey, on the outdoor, there's nothing to say, we can just move on. I think in many of these, there will be like that. And then there may be areas where the board's like, well, we want to talk about that. My goal is to try to discern from the conversation where the board, and when I say that, meaning the majority of the board is thinking, so that when staff brings a document back, it's in line with the conversation today.
But no decisions, no.
There's the conversation is just what it is. There's nothing binding to it. The only thing binding would be a vote the board takes at this point at the August 4th meeting.
So I feel like there are some things on here that maybe I want to check in with other districts, maybe I want to check in with other boards. There are some things I'm not sure I'm ready to give an opinion on, if that makes sense.
And if that's the case, then staff may leave the document unchanged, unless we feel that there's clear, understanding. And then we would, of course, be paying attention to any revisions that come out, like literally since we've been here, possibly, and anything that would impact that. And we would convey that to the board, and we would state that publicly in the meeting, that there's now either a less or a stronger mandate or requirement that then is forced to change. Otherwise, what we would do is just turn the same document to the board, and then the board would be, in essence, writing the guidance they want at the dais.
So it sounds like you're wanting us to just flesh out a little bit for you of, we're not making decisions tonight. Nothing discussed tonight is getting communicated out to staff or families. Nothing is set in stone. We're simply fleshing out, based off of what we've heard, the recommendations that have been given to us. Here's maybe our thoughts, our questions, so you can bring back to the board a working document for us to actually vote on. Is that what I'm hearing?
Correct. And so we would take this document and return it as an action item if there's any changes, that's what we're looking to understand, because there may be a sense in the conversation that staff and I feel that, okay, this is the majority of the board would support this or would like to see this in what's brought forward. It doesn't mean it's binding, but we would have that sense in order to create a document, so we don't just return the same document to you. And it also may be more efficient in the actual meeting if there's areas of agreement like outdoor coverings. Okay, check. We know that language is good. We're moving on.
All right, so I got, just real quick, I got one, and it's more just consistency. So it was the first bullet, mask, face coverings, that first block. Then it was visitor recommendations and performing arts and other activities. So there's a lot of variation between if you come on campus, you've got to wear a mask, or if you come on campus, you don't have to wear a mask. So I'm just trying to, if we can be consistent. So if it's something as simple as indoor, yes, outdoor, no, and then it was indoor, but if it's a game and there's kids, but indoor if you're in front of kids or whatever. So if we can be consistent with that, I think that helps us out and makes an even statement. Just right now, depends on which part you read, it says A or B.
I'm with you. I think the difficulty they're probably running into is the CDPH breaks it out so interesting for each of those. So I don't know, man. Because I'm with you on that, right? And it's almost like I don't know where to start because so many of these go together. I almost kind of want to, if it's okay, like hear from each of you, like what's your overall feeling as we jump into this document? I don't know. What do you think?
Actually, that's what's in my heart is my overall feeling. Like the nitty gritty isn't what's in my heart right now. It's like listening to all of the parents, especially, I don't think, well, I'll just speak for myself. At no point did I ever think COVID was not real. At no point did I ever think that COVID was not dangerous. But as a teacher, and a wonderful teacher got up and spoke, Gina, she was the only teacher, well, she was the only parent teacher that got up and spoke. She wasn't, actually. I take that back. There were a few. But anyway, she kind of spoke some things that were in my heart, so I resonated with her. But being in the classroom with the kids, the mental health. So yes, COVID is real, and yes, COVID is dangerous. There are many real and many dangerous threats that we face in this world every day, and that our kids face every day. Just the flu. More kids die from the flu than have ever been in danger of dying from COVID at this point. And more kids die on their way to school than have died from COVID. And we don't say, don't drive a car. It's too dangerous. Somebody might die. I agree. All the mitigating things that we can do, great. But sitting in a classroom for 6 hours and watching those kids suffer through those masks is awful. It's awful. Even the ones that are upbeat, it's awful. And I will say you see what you look for, right? Often in life you see what you look for. So if you walk around and you're looking for happy kids in masks, you'll find them. There are happy kids in masks. But if you're not looking for something specific, you'll notice what else is there. The shy kids who can't make friends because their faces are covered. They can't smile. They can't make eye contact and have a facial expression that other children can resonate with. They can't. The kids with anxiety, forget it. I had a little girl in my class this last year, and we were in school the whole year. Maybe spoke 2 words out loud the entire year because she was so shut down behind that mask. It takes away so much from kids, and that social growth and social interaction is just as important as math and science and language arts and PE and all of those other things. And I've watched kids who were a little bit shy become more and more shy. Kids who are a little bit anxious become more and more anxious. Kids who were a little bit worried become more and more worried. And they're living in fear. And kids can't sustain that. As adults, we can sustain it for a lot longer. Kids cannot. They can sustain it for a week or two, and it's gone on and on and on. And kids are, I think another person said, going further and further into electronics because it doesn't require any social interaction. And they're going further and further into themselves and becoming different people. My own son said to me the other day, "Mom, I'm a little anxious about going back to school because of masks." He's a senior. And I said, "Oh, well, I think it might be okay." And he goes, "No, I want to wear a mask." And I go, "What?" Because he doesn't wear a mask normally. And he said, "Yeah, it feels weird for people to see my face now." Had nothing to do with COVID. It was just that he was used to hiding. And that's the way it's moving forward. Kids are getting used to hiding. They're getting used to not caring about what they're presenting to the world. And they're suffering. To me, yes, COVID is dangerous. I get that. I'm not dumb. I can read studies. I can see. My son is a nurse. My niece is a nurse. I hear about things that are happening, but I think we have to weigh, as a society, we have to weigh what's more dangerous for them. It is dangerous. It's not as dangerous for children, and it's not going to stop. And there's all these variants coming through, and some kids might get sick here and there. Most of the kids that get COVID don't even know they have it. They test positive for it, but don't even know they have it because they're not getting sick from it. They are getting sick from hiding behind these masks. They're getting mentally sick and emotionally sick and socially sick. And I think we have to weigh that. I think it's very important that we look at the whole child and not just the one thing that's bringing so much fear into our children. And that's all I'm going to say.
Yeah, I'll jump in on that one a little bit. I think there's, three kind of specific areas in this that jump out to me, but they all kind of go together for me. It's been said a few times, we're not the medical professionals. We're not. That's very true. We're not the medical professionals. But we are the elected to implement statewide directives as applicable to our local conditions. And I think it's important, at least for me, I keep reminding myself of that. I am not asking that we do away with all COVID protections. I want to be on record saying that. That is not what I'm asking for. I am not asking that we ignore COVID. That is not my desire. COVID is very real, and there are very real risks and concerns. I do think, though, this talking point of why are we the ones making the decision? Because we were elected to. We were elected to look at everything we're given, the statewide directive given to the state, but implement it as our local conditions see fit. And so I really think it's important that we look to our public health, that we look to our local public health for guidance. And our local public health has not issued a public health directive specifically for quarantines. It actually has not issued a local health directive specifically about enforcement of masking. And so I actually struggle with, I don't know that it's my place to implement anything above anything that is required. I think sometimes those areas people are saying, I think they're interpreting this area of enforcement and this area as an interpretation as you only want to do what you have to do. No, I actually don't feel that it is my right to do more than what we are asked to do, than what we have to do. And I believe when the state and our leaders give areas that are undefined, it is because they are looking to the locals to make those decisions for their local community. And so any area that CDPH is not explicitly clear on, any area that there is not explicit, clear direction that is required, I hesitate to add anything above that, because I think recommendations are meant for the entire state to look at and say, weigh what is going on in your local community. And there are many counties that their local health has given directives to their school boards that they have said, due to our local conditions, this is what ours has not. Now, some interpret that as Well, then you just do what CDPH says. And that's what I'm asking. Let's do what CDPH says. Let's do what they require. No more. That's not our place to make that call. We're not the medical professionals. Let's look at our local conditions. And in the event, public health, our local public health, due to our local conditions, puts out a new directive, then we reconvene and we have a conversation about it then. But right now, my 3 areas of concern that we can look at it directly, but really it's more lumped into quarantines. If conditions were in such dire concern, which I'm not saying there's not a health crisis, that is not what I'm saying, I want to be heard clearly. If there were conditions that required a local health directive, it would be given to us. So the absence of a local health directive is intentional to allow us to look at what we feel is best in light of what we're given. So with that being said, I think the area of quarantine is really, really hard for me. It's really, really hard because I don't think we have found a great solution. I think if we found a great solution, I would still be slightly uncomfortable implementing something we absolutely don't have to. I think we still have some hard roads to climb on that. And the fact that CDPH is saying they do not feel it needs to be required, I think that is not an area that we are skilled enough, knowledgeable enough to implement quarantines when they're not absolutely necessary. Masks, I think it is clear CDPH says required. I do think that there is a responsibility of us as a board to communicate what CDPH has said statewide to our families. However, I do believe in the area of enforcement, there is intentionally not clear direction for us because we are supposed to look at enforcement locally. And I do believe that our local conditions, in light of our local public health officer not mandating a directive to us regarding masks, I lean towards the choice for our families to allow them to have that. That is what we are seeing in the rest of our community. That is what we are seeing at our Board of Supervisors level, our City Council level. That is what we are seeing our local public health level. And then the third area for me that I struggle with is the treatment of vaccinated versus unvaccinated differently. I'm gonna be honest, I'm not comfortable with it. I'm not. I don't think that's our place. And so where that causes hiccups or concerns, really I think the quarantine and the masking solves that for me. I have had, I will say, many teachers reach out to me that are concerned about treatment. Who will know? I know we say it's confidential, but who sees that data? I don't know how we handle that piece, but I just want to say I'm uncomfortable with it. I just think these are medical decisions for our people to make, and so it gets messy for me when we're treating vaccinated versus unvaccinated differently. So that's my overall, and then we can go nitty gritty, but I just wanted to share with you. Those are kind of my 3 areas of concern.
All right, just real quick, I know we have a regular school class, et cetera. We had RVC. The other one was?
We have independent study.
Independent study. Okay, sorry.
Actually, we have multiple things.
Okay.
We have regular schools, we all know it. We have, and that includes Victory as well. We have RVC, which is a virtually taught education. And then we have independent study, which is, relies on some in-person teaching, typically once a week, and there's new laws that we all have to rush to put into policy around that. And then we also have home hospital teaching, that if you're on a medical need, then that teacher comes to your home, works with you, typically is how that goes, or goes to the hospital to work with you. We're required to offer any student independent study, special students with disabilities, their IEP would govern that, but we are required to offer that in independent study. RVC, due to the very low interest that we had from 1,600 down to like less than 100, we are offering the virtual campus only in our first, I'm looking at the team, 1st through 6th grade. Anybody else that would want independent study, it would be done through independent study. Just because we didn't have the numbers to make RVC viable at the other places. The high school, that changed when the laws changed. We had to revamp what we were doing to meet the requirements of daily engagement and instruction. So we have all kinds of options available beyond regular school, home hospital driven by medical, RVC for first through six, and then independent study, any grade that wants it, including first six.
All right, so, yeah, sorry, so thank you for that. I would just say, in general, looking at all of it, and thank you guys for assembling all this, pulling this together, combining all these different factors at the same, it's a pain in the, you know what, but thank you for assembling it, and I'm sure other districts are going through this, so maybe we're not the first one through the wall this time, Roger, maybe? So, I think in general, I like the, I think we can communicate expectations, and I think we can communicate expectations across the board. So I would say, as far as what we need to communicate, we have an expectation to communicate that, whether that be signs, whether that be parent notes, whether that be whatever. I think we can communicate it out, but that choice does come back to that, and this goes back to choice. So I'm really comfortable saying that it is a choice from a mask or a no mask. It's a choice as far as a school, RVC, independent study. We're allowing that choice to happen as a parent, right? Just in the same reason of I want to choose my kids to go to an RUSD school or not, right? Same thing. And then just from an expectation standpoint, I think we expect our teachers, and they do a great job at it, to educate kids. I think we expect our parents to manage the kids from if they're sick or not, if they're going on vacation, attendance. I mean, we expect them to be here, we expect them to do that stuff, but we don't ever crack down or enforce, well, you know, you took your kids to Disneyland and that's not right. We know it happens. I would also expect that if my kids are sick, that, parents are going to manage that, and they're going to pull them out, and they're going to get them well and get them in a position where we can get back into school and educate. And I think from an expectation standpoint, as if kids are away, that the teachers work with the kids in some way to keep them up to speed, to keep them being educated. It's not just a show up, check the box, and I attended, and hopefully the numbers are down, but it just comes down to, hey, keep them engaged, keep them going. If you're away a few days, here's some activities, here's some assignments, here's some things, and then if they are missing a test or some kind of strategic point, they can make that up, they can catch up. We don't let any kids go by the wayside. But I think from that standpoint, it just comes back down to communicating our expectations from all these different perspectives, allowing the kids, or allowing the parents and the families to make the right choice for whatever perspective they have as far as attendance and not attendance, and then as far as the school and where they go. I know that there's hopefully we have very good attendance numbers, and we can back that all up with all the different places, and we won't have to have too many issues with the 3 kids in this class and having to rotate where they go to school. But I guess a different topic for a different conversation, right? Sorry about that.
I feel like as board members and community members, we have the same goal, right? We want kids to be educated in a safe way, and we want what's best for kids. And I hear a lot of fear, and I've experienced it for the last year, as you guys have. Every time we made a change, there was so much fear, right? And I hear that, and I feel it, right? We all have to assess the risk that we're willing to take. I've used this example before. I probably drive a little fast. It's a risk I take. I don't swim with sharks, right? Like, it's just, I don't skydive. Those are my risks. And there are risks in everything. I'm teaching teenagers how to drive. You get it. I feel like we have adults that are making decisions for kids for a reason, and I want to continue to give those adults and the people that care about their kids the most the ability to make that decision for their kids. I am not interested in enforcing anything above what is required. I am not interested in quarantining healthy kids. My goodness gracious, we had a day, a week, how many weeks when we had, there were 7 kids exposed and there were 300 kids sitting at home without quality instruction. And it's heartbreaking. And so, yeah, right. Never tested positive, never were sick. So I definitely want to look at the quarantine. I am interested in encouraging mask wearing without denying anyone education. And those kids that want to wear masks can totally wear a mask, and we welcome that and want them to feel comfortable if that's what makes them feel comfortable. I definitely want to preserve rights for parents that need to make choices for their own kids.
So a few things, and there's probably a lot to talk about, so I won't get to everything now. But so I gotta be honest. In some ways, it actually just seems much more clear to me, I think, than some of you. And so I'll say my perspective on how it is, and that is the law is the law. And I will say, speaking only for myself, I didn't take much of an oath, but the only oath I took was to the law, to the Constitution. And the law is crystal clear that we don't get to make every decision at the school board. There are state laws that we must follow. And it's not, we have to follow the law. And also I think, frankly, one, because it's what I swore I would do, but also it's the right thing to do, to send our kids that we actually are law and order and we follow the laws of the land. The law is crystal clear. It is a requirement that kids wear a mask in class. It's a requirement. So we've had a lot of conversations around parent choice. The law is clear. It is a requirement. We're not having a conversation around enforcement. We're having a conversation around parent choice. That is against the law. The law does not allow that. I don't think that's the right thing to do for a school board. I appreciate how concerning it is. I appreciate folks don't like it. I will also say that last year, this was our policy. And to the best of my knowledge, we never had to kick a kid out of school for not wearing a mask. I might be wrong, but I've never heard of that example. Kids did. It's not ideal. Believe me, I don't want to wear masks. I hate them too. I signed that letter because I would advocate, and I think there's a way to advocate. You advocate by sending letters and saying this is my perspective. You advocate by filing lawsuits, and folks have done that. But you don't advocate by saying, if I don't agree with the law, I'm just not going to follow it. The law is crystal clear. And you know, I had a chance to talk to our lawyers some other day, and the lawyer was very clear to me. The flexibility in enforcement is you don't have to suspend the child day one. You have some leeway to work with the child, and that's a local decision of how you're going to work with that child. Whether you give 2 or 3 options, whether you work with them, how you do that, that is a local decision. And that is something that I'm well open to, because I don't want to meet it. I want to work with the child. But the notion that we're going to get to a point where it's a choice of whether or not you wear a mask on our thing is against the law. And I just, and so, number one, it just doesn't feel right to me. It doesn't feel right. I will also say, I've also been, just me personally, been crystal clear from my perspective from the very, very beginning of this that I'm not a health expert, and the law is clear to me that I swore to, which says the CDPH is the one who tells me what guidance to follow. No other, you can give me all the reports in the world, but the law is written in California, and it says CDPH makes these decisions. And if Placer doesn't, and Placer can make them more stringent, but Placer cannot make them less. CDPH has given me health guidance as the health experts. The law tells me I take their health guidance. And so it's like I'm gonna follow their, because I don't know in this notion of whether or not you know, how safe it is, or whether I don't know. I'm not an expert at that, but I do know I'm given a clear direction of how to know the answer to that, and it's to follow CDPH guidance. And they're clear that they have made a decision, as the CDC has made, as the others, that the safest way to keep kids safe and keep communities safe is to mask in school. So health, for a liability perspective, I think we take huge risk, as we know, if we decide to not enforce the law. We have a letter from our insurance company saying they will likely not back us. So we are choosing to put fiscal jeopardy on our thing. It's something I was very clear when I ran. I don't think that's the right thing to do, and I think it's problematic if we take. And it's a choice. It's a choice we're making, saying the risk is worth it to us to put our district on fiscal liability. I don't think that makes sense from my perspective. The final thing, I know we're going to talk about quarantining, but ultimately, if you read through the guidance, the way to ensure you don't get quarantined is wear a mask. You wear a mask, it's very limited quarantine. So again and again, we keep choosing things to put our kids out of, the best way is to follow the guidance. We will not get sued. We will be holding up our oath. We will be following the law, and we will be keeping kids in school, which has been our goal from day one. And what we have learned, and I do agree, I actually agree with you, Fear, and I will tell you, we did better than I was more fearful, and we were right to move the way we did. We were right to go back to school, and we were right, because what is most important, I am crystal clear, distance learning is horrible. And so being in person is what matters. And so from my perspective, back then and today, whatever gets us high quality in-person learning is what I want to strive towards. And it seems very clear to me that following CDBH guidance is the best way to go to make that happen. So that's my perspective.
Rick, I totally appreciate your perspective, and I totally see how crystal clear it is. And I think I appreciate that, but I also think it's crystal clear because it only takes one thing into consideration. And you're right to take it into consideration, and you're right that we swore to uphold the law, and I don't disagree with it. But how do you measure that or weigh that against the health of, not just the physical health, but the full health of the whole child? Like, I also feel like I swore to do what's best for kids. And you're right, I am not a medical expert, not by any means, and I would never claim to be. And I think CDPH does have the physical health of our children in mind. But I don't think they're looking at the whole child. And we're only listening to one entity, and I don't think that's fair to the kids. I think in looking at the whole decision, CDPH and those guidelines are extremely important, and I think we should follow them to the best of our ability. I agree with you 100%. But there comes a point when they become harmful to the rest of our child. So the cells are safe, but everything else is in jeopardy. And how do we keep one part of the child safe and sacrifice the rest? The medical part would be safe. And I agree with you, we're not medical experts. They have the right to say that's how you keep them medically safe. But what about how do we keep them psychologically safe and socially safe and making friends and doing all those other things that kids need to do? And even learning, trying to hear your teacher with a mask on, the teacher speaking through the mask all day is extremely difficult, and they lose attention really fast. I think everything we're doing in school is jeopardized by the mask, except for that one thing, their physical health. And I agree, you have to have one to have the rest, but I think how do we find a balance without just going with that crystal clear part that I think is easy? And I know you said for you it's easy, and I get that, but it's only easy because you're only looking at the one part of the child, and I think that's not fair to the kids to take the easy road, which it is the easy road, because if we just follow CDPH, we could blame everything on them, and the kids go to hell, and we just blame it all on CDPH because they made us do it. But I think that's kind of taking the easy road, and I don't think we're here to take the easy road. I think we have to look at the hard choices that might not be so easy.
So, yeah, I totally appreciate that. I mean, I really, really do. And I appreciate that it's hard. It is. So I guess I'm data-driven, as I often say. And so where I would disagree respectfully is the premise that we're mentally hurting kids. I haven't seen data to show that. I've absolutely heard anecdotal people say it. It hasn't, you spent a lot more time in a classroom, but I was, once a week, not quite a lot, but subbing a lot in our classroom. It wasn't my experience. Certainly there was, but it wasn't my experience that there was widespread. I didn't see widespread referrals. I didn't see widespread hospitalization. I didn't see that happen in our schools last year when we lived under this thing. So I don't know that to be true. I just don't know it to be true. And so again, from my perspective, I don't know that to be true. I do know the medical experts are saying this. And so if it were a choice between what's right for kids and and I knew it not to be, then I agree with you. But that's not been my experience. I have no reason to believe the medical experts aren't. In fact, I have a reason to defer to them with their expertise in what's best for kids, because it's also keeping them safe from, and again, it's not just kids getting sick. Kids do get sick, but kids also are carriers. They just are, especially the moment they are. And so they do have the potential, if we let down our guard, to spread it to others in the community. That's why, so again, the reasons why, so given that, again, would love to get rid of it. And it's only because we're in a pandemic we have to do this. But as a result of that, given the medical experts tell me what, and again, I'm not. So I'm going to say I believe. And again, so, yeah.
You know, I hear you. I agree with the data-driven. And I am trying to find the answer as to when will we not mask our children? And so that, I think as a school board, we have to ask that, right? Because I actually don't know that the answer's out there because, and maybe it is, and so please inform me. And that's why I love that this is a study session, right? Because we're able to just throw things out there. But originally, the reason I was given as a board member was that students can spread the virus. Even if it's not lethal to them, they can spread it to others, to a population group that it could be lethal for. Now, I know there's different contentions and thoughts about that, but I do believe that was really well agreed upon, right? And I actually understood it. I did. Now, those of that population group, though, that desire to get vaccinated, they have had the option to. They have now had the opportunity. And so, although I understand when we say, hey, this was our policy last year, we were in a very different place last year. This year, we're in a very new place. 12 and up that want to have access to a vaccine have been able to, and they've chosen to. And those that have chosen not to my knowledge, it's not because they weren't allowed to. It's because they're making this self-choice that they don't want to. And so I guess I start to get concerned now when we are asking our children to bear this burden. You know, that's what I heard when we're having this conversation. Well, they could spread it to other people. Well, but then we're asking them to bear a burden for people that have already made their own individual choice. And so if we didn't have that option for adults, I didn't love it then, but I at least could understand it. I really can't now, because now the narrative's changing, and I don't understand. And when I ask why or how long, I have some people tell me, well, Tiffany, wouldn't you agree? Isn't it great that kids aren't getting the flu as much and the cold? Please tell me that's not why we're masking our children. Please tell me that's not because I don't want my son to have 102 fever for 2 days. I don't. It's not enjoyable. My daughter is 16, and when she brings something home, that means my 2-year-old has it. And if anybody's ever had a sick 2-year-old, it's miserable for the whole family. I actually take work off because I know I'm gonna need to be home for 3 days. But I know I'm gonna need to be home for 3 days. And day 4, we're back, and we're good. And so I guess that's where I struggle with when we say, well, we gotta be data-driven. I actually don't think the data's there to show that masking students right now is safe for them. Safe is a word that means different things to different people. Safe, are we saying to keep them from dying, keep them from going to the hospital, keep them from getting a sickness that they could be over in a couple days? I don't think we actually have enough data to show that. That's why I say, man, if I'm gonna limit them on something, I'm not saying we go against the law. I heard you loud and clear. I took that same oath, and that's really, really important to me. There's a lot of people in the community. Let me tell you, I get the emails that think I just don't care about the law. Listen, I was growing up, I was a goody two-shoes, okay? I was the one in the family. I want to follow the rules. I do think, though, that there is a reason that there is requirement, which is the weight of the law. I'm with you on that. There's a lot of people out there that email me and say, Tiffany, do away with everything. I think that would be reckless. I think that would not represent our entire community. And I hear the parents that spoke tonight that said, I am scared for my child. And I want to do everything I can and put every precaution in place to help them keep their child safe. But I cannot do that when it's above and beyond what's required of the law. Does that make sense?
No, because I don't know what we're doing above and beyond what's required of the law. If we follow option A, what are we doing above and beyond what's required of the law?
We're implementing an enforcement to essentially deny students education that they should not be denied.
Which is the law. The law is if they do not wear a mask, they're required to wear a mask in classroom, and if they do not, they are not to be in the classroom.
It does not, it is actually, I have not seen, and I asked our attorney, and I know we're waiting on a response from him.
His belief was it did agree. He was going to get back to his belief, but more importantly.
Wait, I appreciate you, but not, the entire community was not in on that conversation. His belief was it's a risky decision because it could put things in jeopardy, but there was not that exclusion due to masks is required.
Yeah, we heard it. I heard him articulate why he thought it did say that at the end. He went through, but regardless, it feels to me what's very clear is that it is a requirement that kids wear masks in classrooms. And again, the data-driven, which is to say, if the requirement very clearly is that kids wear masks in classroom, and we walk into a classroom in Rocklin and half the kids are wearing masks, we are not upholding the law. And it seems crystal clear what we're talking. We all know if we go with B, the reality is we will not be following the requirement. And again, I thought he clearly articulated what was flexible, which is how long you have to make that decision. And that wasn't my words, that was the lawyer describing what the flexibility was. He did not describe the flexibility of whether or not it is kids must wear masks in class. It is clear that is the requirement.
So, but what we have is the ability to implement local protocols to enforce.
Right.
For sure, no one's arguing
Again, timeline was his argument. Right, exactly.
Right, okay.
Are you requesting that we exclude children if they show up without a mask?
I'm requesting that we follow the law, and that's what the law states.
No, so actually there was a backtracking on that about
No.
excluding children. No, so I'm asking you, so Rick, how do you see it playing out? What would make you feel comfortable? How do you see it playing out? So I do think we're in a different
The same
place.
way it did played out last year, which was we will require people to wear masks. And that's how it played out last year. And we will do the same thing.
So if 400 students on August 11th show up without a mask,
We will follow the law.
what does that mean? Do what?
We
The
will-
law says enforce it as you see fit. So how do we enforce it?
So maybe you can jump in if you have it, but my reading of the law says that ultimately if a child refuses to wear a mask, they will be removed and we will offer them alternative education. That's my reading of the law. Do you read the law? Is that your reading of the law?
What I think that what I heard legal counsel say was that the enforcement of that is local. So i.e., like was said, do you give 4 warnings, 2 warnings, whatever that means to work to get enforcement? At some point, you either have people complied or didn't. And so again, and I'm not an attorney, but what I thought I heard was the enforcement is up to the local district and how best to do that. It's not an automatic, you're excluded, which was the original, but but how districts look on the enforcement. And then I know that our legal counsel, we'd asked, well, what does that mean? I mean, does a range mean that if we've informed you of it, but if you choose not to, does that comply? Or at some point we have to, after working with you, and that could be a lot of mechanisms of multiple warnings or multiple redirection or whatever that may mean. Like we have a SARB process for attendance where we send letters. Ultimately, we have a hearing or meeting, and then there's an action. So there's like a due process. If we did that, what constitutes, that piece? And there is not we haven't had a clarity of, well, if you give 1 warning or 100 warnings, and theoretically you could say 1 is closer than 100, but what constitutes that? So the local districts are left in a place that determining how to enforce that mask, that requirement from CDPH. And so that's where staff could, and the board could say, this is how we want to do that. But ultimately, if somebody says, I'm not going to, then do we exclude them from school to independent study, or do we not? The CDPH guidance says this is the piece. But that's really, in a sense, the wrestling point related to this. And then I think this is true with any law or guidance. The closer you adhere to the letter of it, the less legal risk you take. The further you deviate, the more your risk increases. And that's this, and it's pretty much anything.
So what if we had some options on August 4th of different ways to enforce? Like 3 or 4 different options?
And again, that could work where it's like so I think, and I'm inviting colleagues to jump in. So we could say, okay, so in elementary you have 1 teacher. So it might be, I didn't wear one on Monday. The first piece is we inform redirect the child, please wear a mask. The child says no, inform the parent. okay, then if it's the next day, I mean, so how quick do you move through the process, or is it, over time? In a secondary school, would it be once in the day or per class? And so thinking through those would be something that we would have to think through, but, you could be in a position where in 5 days, you could have 5 stages and then you're there. Or it could be over, well, we'll do 1 reminder a week. Well, does that comply? And at what point? So that decision is, where do you get to that, if you will? No, you have to, or no, you don't. And so I think that's where
You're probably
we
just
end.
asking, but do you have an idea? I don't. Do you have what when you say the 5? Do you have an idea of what the?
No,
yeah, right,
not really. I mean, in my class, when kids take their mask down or they didn't have their mask on, I just go like that and move on with the day. I've heard so many stories and seen kids being harangued for not having their masks on, and I mean, they're pouring down sweat and their mask is filthy and covered with slobber, and they're being screamed at for not having it over their mouth. And I mean, some standardization would be good. And I also think it's clear in there, it says wearing a mask it says you're considered not wearing a mask if you have it off for 15 minutes. You're 15 minutes or more in contact with someone. So I think even the mask requirement should be loosened. Kids should be able to drink their dang water bottle, and they should be able to pull it down and take a breath and put on their chapstick. And yeah,
absolutely clarify
And
that.
we see
Could not
that,
agree more.
and we
That's
see
ridiculous.
that like you can, we're able, under the guidance that we read it, that you can go to the cafeteria and have lunch and not wear a face covering.
Right.
Because you're eating. But when you go into this, and so we see, and I think that there is some of those clarities of, no, it's not like you can't drink water, you can't blow your nose. I think we also find, too, that even all this whole past year, there was that piece where it was mandated, and if you didn't, you were not allowed to be there, that students, we did that as adults, reminder, hey, it's slipping, hey, put it on. Was a constant piece, and when we had that, we didn't have students go home. The only place it was in a student said, I'm just not going to do it.
Right.
Right. That's when and that's where we ended up with that. We didn't have that situation, thankfully. And so even if the board were to, say, adopt something that has enforcement, it wouldn't be well, you let it slip, the 5-minute clock went, now you're gone, or triggers that, and that wouldn't be it. It would really be, I'm not going to wear one because for whatever reason, they have. That's not exempted by law. So, but we would need to have clarity so that the enforcement of anything would be uniform and seen as fair and not capricious or arbitrary. Would be, and we could also clearly communicate to parents and students. But ultimately, if that's adopted, it comes down to, at some point, if you reach the end of the road of that, then you would be excluded if the board were to adopt something. If not, then it could be, you could go through that, but then there would not be you're excluded. So that really is the kind of the hinge point of the board conversation.
Just for a, I guess, point of reference, when we talk about attendance, not major disciplinary, apologize, more minor, but like how many warnings, how many checks, how many things do we do, just ballpark on a count? Is it, hey, after 5, after 6, at what point does the truant officer show up? At what point does you're expelled type thing? I don't.
We've taken a more proactive approach, yeah. And again, sites do reach out and talk and remind them. Obviously, every day you miss of school is going to have an impact, and so we don't wait until day 18.
I just wanted to throw out another thought of where I'm at. I want our teachers to get to teach. And I could not imagine this environment without consistency. And I know we talked about consistency, but man, I I want our local public health to be the enforcers. I don't know any teacher that signed up to have to focus on enforcement so much. And I'm not saying we don't enforce. I want to make sure that's clear, but I am saying if local public health wanted to enforce, they very well could. And they're not. And so I think at what point do we ask ourselves, is this a teacher-student concern or is this a parent communication concern? And I would like to see the options given to us be more parent-directed. I think if you go right now and you don't tell anybody you're going and take a drive around our community, I think you will see some will be masked, many will not. Large majorities of locations I'm going, it might just be where I shop randomly. There's a sign on the door, and then there's the due diligence. I just think any enforcement that we implement, I would like it to be with the parent. I do not think this is a standalone child making this decision on their own. I think these are families that have made decisions as a family, and I actually think it's incredibly cruel to have a conversation with a child about masking enforcement. If our own local public health isn't going to do that and enforce, and they're not going to stop me when I go into businesses, I'm not comfortable with somebody doing that to my child. I would like it to be a letter to the parent. Whatever steps we have is to the parent in conversation with the parent. I do not like the idea of removing students. I am not interested in at a future board meeting receiving a list of here's 400 students that need to be suspended or expelled. I don't want to see that happen.
That would be illegal under the law, right?
Yeah. Good. So we won't see that happen. So with that being said, I think any enforcement options we look at, for me, I would not be comfortable if they weren't directed towards the parent instead of the child at all ages. I think even teens. My 16-year-old, we're going to have conversations as a family. She's not making independent decisions. She might when she goes on campus, but let's be real, this is different than typical disciplinary actions that we've had in the past. Families are making decisions, and the evidence of that is looking at families out in the community. And so I do think kids complied, wore masks, did it. I think last year was different. I don't think we should assume August 11th that there's going to be that across the board. And so I think we do our due diligence. I'm not saying, Rick, that we just say, hey, we're not going to do anything. I think we say what CDPH tells us to say. We post it, send a letter, communicate with the parent, allow kids to be kids, and allow teachers to be teachers. Everything else, handle it outside of the classroom, is my suggestion.
And our typical first piece is redirection of the student to the rule, because we don't know if the student forgot, unaware. So that's not a discipline, it's a redirection. Hey, don't run down the hall. So it's not discipline, it's a redirection. And so that's typically like when Julie said, hey, when the mask is, they take it off because they're drinking water, forget to put it on, that's a redirection. It's not a discipline. I don't foresee us suspending children or expelling children for anything related to this, because that's not a piece. Now, if a student unleashes a tirade of profanity when you talk to them, that's different. But right. So I think even on the attendance piece, we send the letter, we inform the family of the expectation, and then that moves through. But as far as disciplining, we wouldn't be, this is not like that disciplinary piece, because under the way the CDPH is framed, it is the ultimate, if you will, consequence is exclusion from the normal school to independent study. And so it wouldn't be a discipline, a suspension, that type of thing. Now, it could play out that you could have a teacher send a child to the office because they aren't wearing the face covering, and then you have that redirection may occur there, and then you send the child back. So there may be those pieces, because under Ed Code, teachers have the right to send a child out of their class. They need to communicate to the parent why, but they do have that. So again, we wouldn't be looking to have discipline occur, but it would be more of that informing. But we always start with redirection back to the standard.
But independent study would be them not on campus, correct?
Right. I mean, no, that's the piece. So if the board were to contemplate, plan, say, okay, we're going to do this mechanism and it's this process, then then the question comes, is there a point where students are saying, okay, we've reached the end of the road on this, now they're putting independent study, or not? And because anything we do like that, the question will come up of, so where does that leave us?
I do think it needs to be really clear, because from a teacher's perspective, I need to know what the guidelines are, what the boundaries are, and I know, like Tiffany said, growing up, she was a rule follower. A lot of teachers are rule followers, and if the rules are vague, they're gonna be done all different ways, all over the place. And I'm not saying hard and fast rules need to be implemented. I'm just saying the guidelines need to be clear, like what is the expectation? And I think it needs to be clear, and I wholeheartedly agree with Tiffany that we should not be holding children accountable for their parents' decisions and their family decisions. And I certainly don't think children should be yelled at and sent out of class and embarrassed. And I think, no disaster is going to happen if a child comes to school without a mask. It says right in the guidelines that we'll provide them with a mask. So provide them with a mask and then remind them that it's, they have to wear it. But then this is where it gets hard, because the teachers that are rule followers, and they're going to stand there and they're going to want to make the child follow the rule. And I just don't want to see children harangued over this.
I mean, and if say the board were to put in something that says, okay, the first time it does redirect, you could say, we're going to send parent a note, the student still stays in school, because this is the first level. Okay, so then next day or next occurrence, then is it the same piece and yet it's another, but the student stays in school? Is there some point in that, kind of like with SARB we do, where you say, okay, we've done these pieces, and now at this point, you're excluded. So it doesn't even have to be that, like, on the same day, if you don't, you go home that day. There could be we did this, you can say. So there's a layer of that immediate, and that's where, unfortunately, frankly, or fortunately, whatever, CDPH says, you get to figure out how to enforce this. So we could have 1,000 different ways throughout the state that this is enforced. But there's an expectation of some type of enforcement, which the board has acknowledged and said, we're just trying to figure out, does it involve exclusion or not? But we get there's an enforcement mechanism, whether it be letters and signage. So and then public health has said, like in a lot of these pieces in businesses, enforcement is to local law enforcement, if you will, so they choose or not to. Well, they've said in schools, it's the local school district is the enforcement mechanism. And so that's where public health isn't going to come in and enforce anything. That's where the liability of the district is set to say, your liability is you're the enforcement mechanism, because as we all know, we are unique in that we act in place of parents in schools, in a sense that we have the authority, that we're kind of locus in parentis, that Latin phrase of in place of parents. We have that responsibility, which is different than outside of schools.
Actually, and I think I'm comfortable, similar to, call it, general commerce and stuff, with more of the, in general, using signs and notes and communicating out expectations. I think as it gets closer and closer to the kid, much like anything else, like the class, just going down a level, you can use similar signs, or you can have something go up. It does come down to a teacher and how you manage it. I can see that, hey, Mr. Flowers, I'm in his math class. You know what? There's so much stuff going on. Maybe the quote-unquote hardcore enforcement is minimal, whereas Ms. McDonald, whatever's going on in his math class, nope, I want to have it as a topic, and I want to say, Rick, you're doing this, Michelle, you're not doing that, and et cetera. So as long as we're consistent, and at least as we can provide a consistent expectation to the teachers, I think in general we can do really good at communicating out on a broad topics as far as, here's what we expect. I think we can send the letters home. Here's what, I think we did it all with the COVID stuff. There was a issue that happened at this school, and here's what it was. It still went back to the parent making a choice. If that made me nervous, I could keep my kid home from school. Most of the time they were sending them to keep it going because they wanted the education. So the consistency on the expectation of the teacher is real critical, because I can guarantee you're gonna have people coming to meetings, you're gonna have emails that said, similar to, and I'll say it's junior high attendance for the first period. There are some teachers that take attendance on the dot of when that second hits, and there's other teachers that take attendance within the first 30 minutes. And there's always a little bit of variation, and those kids get sent up, and then it comes down to how we want to manage it. I know both my kids got notices that you weren't here at this one class, and it was the same teacher. But you know what, at the end of the day, as parents, we made sure that we were going, it was always a carpool issue. Sometimes you hit it, sometimes you didn't, but it just, I mean, if we can be consistent. Sorry, go ahead.
Thank you. If I may ask a question, I'm going to step, well, primarily because I want to make sure I get on the docket as said one thing sitting at the big table today. And I don't mean to step over in your lane. It's just thinking about this, and I'm a restorative practices person. So I can, in my head, I think we're talking about really the guidance that I'm seeking. I can come up with 800 different steps along the way, but at the end game, I think really the mystery that I have is, and I think you're accurate, is it's the kid that's been told not to wear a mask, period. What is our, and I don't think, and I'm looking at you guys, because ultimately I think we'll probably work together on we can easily put 42 different things, because really that's the pool of really that all I think is a concern, because like the Lincoln Limoges, my son who's got his mask on the side of his head and all those different things. I mean, I think those are easy to handle, like wearing your hood at the dinner table kind of things that I do. I think the guidance for me, and I hope I'm not out of the box here, is like, at the end of the game, that kid that says, I don't care what you say, what you do, however you do it, I'm not going to wear the mask, and for whatever reasons that they choose, I think that's, and I don't believe in suspending the sending home for this thing, but there's got to be something, if it's, I mean, the only thing I can think of in my head is like, unfortunately, you got to go to independent study. I'm not saying I'm suggesting that or recommending that, but there's going to be an end game here that I think we need the guidance. And I agree with you, Tiffany, too. Is like, this could become a nightmare of what step am I on with Tony in class. Is this 7 or was this 6? And I don't think we need to have spreadsheets and things like that. I think most of our teachers will handle it as it is in class like we did all the time. And then when it becomes a pattern, it will go there. I think that's easy to put some things in place. And I don't think anybody at this table wants to suspend a kid for that unless the tirade. But it's that.
But I think in that example, it becomes a disruption to the learning environment, right?
That part is, or defiance or something.
Yeah, but I think you're stepping to that point.
No, I'm talking about the tirade would be defiance. I'm not, like, if it tells you off and I think you're stupid.
But I think that's an important conversation for us to have, right? Is defiance them not having the mask on their face? Is that willful disobedience? I struggle with that one, guys. Like, I do, again, and I just, everywhere I go in the community, nobody asks me, nobody enforce, and I just don't understand why we would go down that road if not absolutely necessary. We are asked, and I believe I actually saw some recommendations were given of what schools can do, and I would want that vetted. I want to make sure, I've had lots of people give me lots of information, so I'm going to say I want this vetted, but I was given some information that that the responsibility of the district is an enforcement plan to be in place. A possible enforcement plan is we direct our staff and our students to the CDPH guidance. This is what the guidance has said. We are an educational center. We are going to focus our time on educating our students, and we want our teachers to be allowed to do that. And so therefore the recommendations that have been made, and I believe this was CDPH, so I would love to be corrected if I'm wrong, because I want to make sure. This is why I don't love board study sessions, because you throw things out there, and if it doesn't stick, please wipe it off the wall. But it was communicated to me that enforcement, an option provided was to post signs, and you redirect the student or family to the CDPH guidance, and then you go back about your learning environment. So I throw that out there.
And I think that, and that be kind of, again, that's the essence of the pieces. And when we, sought legal counsel on that, that's where they kind of said is, yes, that you're not outright defying the law because you're informing, you're acknowledging it, you're doing those things, which is, you're not in the most risky position. However, I can seek to reclarify, but at the end of that piece is if the steps in enforcement don't involve at some point somebody consistently saying, I'm not going to wear a face covering, and they're not excluded from school, does that meet compliance? Because that's the piece where you could have 3 letters that go to parents, it's not seen as defiance of the kid, no consequence, and then if that's, and you could say the letters will be a week apart. I mean, you could set up something like that. So students in school all this time, but they're getting these progressive warnings. But at this point, if the enforcement, I guess the piece is if the enforcement mechanism doesn't involve exclusion of someone who refuses, is it compliant or is it valid? I think that's really that question that is wrestling with. And then I think, again, because you could say, well, if it takes us 4 weeks, it takes us 4 days, it takes us 4 months, the further you go, probably the grayer you get. But if there's an enforcement mechanism that never involves exclusion, is that valid? And that's kind of the wrestling point, because those school districts that we've seen that have put that in of we aren't going to ever exclude, don't know that, and we know that's the conversation piece, and we have others that are saying, may say we're excluding day 1. So
The good news is, I hear you, the good news is it doesn't say you have to enforce the mask requirement until exclusion. It doesn't. It just says that we have to enforce the mask requirement.
So what if the final, and this is silly, it is, but because we keep talking about exclusion being the final straw, but what if the final straw wasn't in exclusion? What if it was something else? What if it was you have to go sit in the principal's office and write out CDPH guidelines?
Maybe you have to pick weeds.
I mean, again, I'm saying it's silly. It's silly, but it doesn't have to be exclusion.
Students, I think we're setting up our teachers
Yeah,
for very
you're
difficult
right.
situations. This is not a decision that is, a child's taking a pencil and throwing it at the teacher's face, right? That is a very different situation. This is, our community has wrestled with this for over a year. Like, I don't think we can sit here and pretend and say, and not that anybody's pretending, I don't want to pretend and say, the reality of the day is school starts August 11th. There is a community that is asking us as a board to tell them what will our policy be. I'm simply saying I would like to see our policy be only what we are absolutely required to do. And I hear a lot, I know we went round and round with legal counsel, and he's probably watching this going, I wish I was there, they're quoting me. But there was that conversation point, right, of the less strict enforcement you do, the more possibility you have questions and people pushing and people requesting and asking, and maybe some liability, some not. But there was an understanding and a conversation of who enforces the enforcers, if that makes sense, right? And it's the local DA, the local public health, who in all areas of Placer County have not mandated that. So again, I want to make sure I'm clear. I'm not saying we don't do what is required of us, but I do think for us, when we say enforcement, for us to make that, in my eyes, is a leap, that it must include exclusion, when I do not see that. And the reason being, because it sets us up a little better legally, I disagree with that. Because I have not seen in Placer County where businesses that have done their due diligence to enforce via signage, that they have been reprimanded in any way. And so, and I'm not saying, oh, I'm gonna risk people's safety. I know the emails are already coming because we're not gonna get in trouble. That's not what I'm saying. I'm saying if there was that great of a concern, there would be an enforcement policy happening in our county. The fact that it is not happening right now, that we have students all summer long that are not wearing a mask, and we are now saying August 11th, something magically changed because school is starting, I don't think it's right. I don't think it's consistent with our legal conditions, and I don't think it's consistent with our legal enforcers. If they're not, I think there's a reason. We do legally what we're required to do, and no more. I don't like exclusion.
I agree. I don't like exclusion either. I don't disagree, though, that there needs to be some end point. Like, if you don't have an end point, it is pretty useless. But I don't agree that it has to be exclusion.
Can you help me work with how to, so again, the law says K-12 students are required to mask indoors. Required. So how do we get to an end that complies with the law?
So can I just ask you, Rick, do you always drive 65 miles per hour on the freeway?
No, but I tell you what, I can get arrested for it. It is illegal. And if I get pulled over, they can.
There's a
So
chance.
with this notion, I gotta say, this notion that says the law's clear, the statutes are clear, that we're responsible for enforcing the law. This ed code.
But it doesn't say how.
But it says we're responsible for enforcing the law. The law is clear and required. The notion that says, yes, but we think we won't get caught. So kids, if you think you're not, no, it's exactly what we're saying. We're saying we think, you said the DA is not likely to prosecute. We think there's not a likely issue. We think the risk is worth it. So we're saying we think we're not going to get caught. So let's not do this law. And it'd be the same as sort of saying we kind of don't like algebra in Rocklin. And so we're going to, I know it's a state law that you do algebra, but we're going to say we're not going to force it. And you can go ahead and graduate algebra. We don't, that's not how our laws work.
You're right, but I know there has been some mixed messaging, but that's just because we're just talking it through. We don't, and so a lot of things are getting thrown out and a lot of things are getting said, and I know it could be confusing for anyone listening, and just like some of our ideas, we have to be safe to be able to say them, and then they might get shot down. But we got to be able to get them all out there on the table. And I don't really think that any of us are saying not to follow the law. I really don't. I think we all have the intention of following the law. We're just trying to figure out how to do it.
So here's where I get caught though with Julie's, where I don't understand, if the law is clear, it's required, I don't understand how we get to a place where we're not requiring it and say we're following the law.
I know what you're saying, and you're talking about but that's the masking part. The masking part is required. And I think that we're all walking our way slowly to that point to understand that we have to do it. But then the enforcing part is, it doesn't spell it out. It doesn't say how to do it. It says you have to come up with a plan.
No, I understand, but I'm saying if we get to a place that actually ends in kids not wearing masks in our classrooms, we are not enforcing the law. We are not doing our job. It's required. It says it
It's
very clear,
required that we
and so
have.
they say you can figure out how you're going to get that law to happen. It is our choice how to figure out how to get there, but it's not our choice to get to the end game, which it's required. So if I walk into one of our classrooms 2 months from now, and half the kids are not wearing masks, we have not complied with the law. We just haven't.
Go home if they're not wearing a mask.
That's what the law says. I don't think they should. The law says that. The law says you can figure out how to do that, but the law says at the end of the day, if they refuse to wear a mask, they could be, by the way, just aside, they don't have to leave school. They just have to leave the classroom. We can put them into a different way. There are options we could explore. There are different ways to do it, but it says they will be removed from that classroom. That's the law. And so it does feel to me that we need to follow the law.
Well, I think we've all probably shared where we stand on the first box, right? I hope that's okay. Is it okay if I say that? Because I think we may not all agree, and that's okay. I don't. You're not clear. Maybe you could rewatch it. No, I'm teasing. Because I actually really appreciate. I don't know that there's any perfect solution. If so, I don't think we'd have to have a board study session, right? But I think the intent of the study session is to just try to flesh it out a little bit and go, okay, I want to make sure I fully understand. So when I come August 4th, I know exactly what I am talking about with you, right? And so I wonder, I'm not trying to cut off the conversation, but I also wonder if at some point it does come up to interpretation of enforcing who is required to enforce to meet the law. And I think at that we may just not agree because there is vagueness there, and some may disagree that there's vagueness. That's okay. But I wonder if at this point, could we talk, do you need clarification on quarantine? Could we talk about quarantine maybe?
Right, I mean, what I would say is, based on this conversation, I would not be changing what is written and presented to the board and would leave you with the two options to wrestle with, because there's been a lot of, I think, clarification of people's views and what we're wrestling with, but on masks. And so that's, now if the board were to choose an option A or B, you still could say, And we may look to say, you know, a sequence of X number of letters, but, you know, this is how we would look to, you know, we can work on developing, here's how we would work to enforce whatever it is. In this series, we heard the intent of not on the students, except redirection back like we would normally do. But any enforcement goes to parents. We could work to put together a sequence, but the question you'll be left to wrestle with next Wednesday is, does it involve excluding students? But we can work to kind of share and it could be done through like a SARB process so that the board could see what that cadence would be, how that would work, because either way you choose, we need to have something. And so we'll come up with that, but under this, I would give you back both option A and B and say, please choose. So yeah, we can move on, but I just want to tell you how I interpret it and how I'll be directing staff. And I also heard some additional legal questions to try to provide information. So on to quarantining.
So just making sure, option B is saying the student's reminded of the expectation, you're saying that's just that initial.
Right. I mean, we direct the student to the expectation, and then we would offer a face covering, but it doesn't involve exclusion. Based on the conversation, I hear an interest of, well, what would that look like? How are parents notified? So we could put together a suggested cadence of parent notification and what that means. And we could use that whether whether the board wanted to exclude or not exclude at the end of it, because I think that is also in meeting the interest of the guidance is, so how will that, because I think how will that function, how will that operate, so that we're aware of that. And we don't want it to fall on teachers in a classroom to have to do the, if you will, enforcement. We do want you to do the redirection, because that's your job as a teacher. And you do that every day on all kinds of stuff. But enforcement, we do not want at the teacher level for all the reasons you described, and we would need to, you know, have a uniform way we're applying it, so.
And the reason I ask that is because if I were to say, hey, next week, option B, does this mean like a student is sent to the office 10 times in one day though? Like, you know what I mean? Like, I wonder, is there a way, and maybe that's something we talk about next week, but is there a way that it's added in that this is to allow teachers to focus on teaching, not on enforcing? Because to choose option B, I get it, but if option B still means a student is sent to the office, I do not want students receiving punitive measures for this, because I think this is very different than a typical disciplinary action. So I almost wonder, does there need to be an option C, is the reason I'm asking that, of all communication is basically with the parent regarding this.
Right. I mean, again, I would go back to, we say clarifying that teachers redirect. If there's a discipline piece around this, you know, I mean, that would be the expectation. And again, teachers, you know, we have over 600 teachers, and we work through, and as a principal, you work through how everybody enforces the tardies, and this a little bit different as Derek. So we can give the best guidance out, but in is saying, you know, feel free to redirect. Obviously, we don't want kids harangued, harassed. Anybody doing that, we would address that like we would any other issue, and we would, you know, if it came up, we either saw it or came to us from a parent or student, we would, and we normally do, and we don't have a large occurrence of it. The other piece would be then, you know, in an elementary, you can see the teacher's aware that something occurred, single teacher, single kid. In secondary, the second period teacher may not know what the first period teacher did, and so that piece of, well, if a student's not doing this, refusing, how do I notify the office to do this thing? And so that could be that piece where, you know, we have that occurring. The other thing I'd say is and I don't know this would play out this way, but again, teachers under ed code can say, I'm going to exclude a student from my class for the day, and the next day they need to communicate to the parent, and that's something that we can't say, you can't do that.
For not masking?
Not masking,
Or is that
but
only
it's
for disciplinary action?
only under what's defined in 48900, I think, area 10 of the ed code, and we can get a list of what that is.
Can you get me a copy of that soon? Okay, thank you. Sorry, I didn't mean to interrupt you.
No, that's, and so what we want to do is, and then there will be variabilities. We can give out the direction, but some teachers may say, well, I'm sending you there, and I'm not, and we could work to clarify, and the best we will do, we will still have some tolerance differences and interpretation differences that we have to work through with staffs.
Are there any other board members that would like an option to look at on the 4th that focuses more on teachers are not the enforcers, that we're enforcing via written form?
Sure. Are we thinking we're gonna come up at the end with a policy? Is that what you want? What would be
I mean-
best for staff,
I mean,
parents? I don't know.
Well, I mean, August 4th will be, a week before school starts, and I feel an urgent need to communicate to families and parents. Here's how this will work. I think the interest that people will have is, will my child be excluded from school or not? How many letters you send me, how many ways you do it, I don't think parents really have a great deal of concern about until they're getting them. But I think ultimately they'll want to know, is my kid going to be allowed to attend your schools if they don't wear a face covering this year, or are they not?
I also think they're going to want to know if their kid's going to get yelled at all day, every day.
Well,
So does an option C
Or
provide that?
guilted, and so I just wonder, as a board, we might need to set that as this is our
Well,
expectation as a board.
As a board, we already have the expectation that children are not yelled at and embarrassed in our schools.
True.
And so, in any circumstances. And so, if people were to do that, there's ways we would hold them accountable for that. I don't know that we need to restate that. I think what we could be clear on is that, again, teachers free to redirect. There will not be suspension. There will not be on-campus suspension for failure to do this. So the board could be clear that we do not want to see student discipline consequences given for failure to wear a face covering. Period. And this would be and then we would want the school district to do this cadence of notification to families. So the board could make very clear that there should not be student discipline consequences imposed for this. And I think that would be enough to direct school administration in how to implement that. But I don't think we'd have to go to directing staff to be appropriate, because I think we have that, and they are, by and large. So we can bring back A, a little bit of the cadence, and then we can put in there, from what we heard, a piece that the board could adopt that says no discipline. So we'll write that explicitly in the document so that we didn't talk about exclusion, but just you get a suspension because you didn't, type of thing.
But the difference of A and B is the exclusion piece.
Right. Exactly. But in any enforcement, I've heard we do not want kids disciplined for this. We do want a notification, redirection at the earliest level, and then the notification, and then.
Transferred independent study deemed as exclusion,
Yes.
but not in the same category as suspension.
Right.
You
Yeah.
can't suspend, you have to, under the law, put them in independent study. You cannot suspend them.
But independent study would be option A.
It's actually what they say. They say provide an alternative education setting.
Right.
Sure, we're saying that's exclusionary.
Well, meaning we're excluding you from the.
That would be the most obvious option, since we already have a system to do
Right,
that.
but I also have heard the board say, we do not want students suspended or expelled for failing to wear a face covering or sent to on-campus. Right, meaning excluded from the K-12 environment to independent study. Or involuntary transfer, if you will,
Box 1 was a doozy.
Well, it is a $64,000 question box, so congratulations for moving us to that. Thank you. So quarantining, do you want to take that up next? No,
I think we're all in agreement if a child is sick, we have our sick policy and procedures, correct? I think the one thing that I heard, and correct me if I'm wrong, colleagues, I would still like to see expectations parents can count on when their child is sick at home. And I think we talked about there was independent study, there were some great options there. But how are they notified of that would be my question. Those that aren't watching this meeting, how do they know what learning options they have in the event their child is symptomatic and needs to be at home?
I think the obviously the K-6, it's a direct conversation, email, whatever, from said teacher. The challenge, and we saw it last, going through it, is 7 through 12, and how the variability of teacher A is, and the learning environment of teacher B versus the expectation of just showing up for teacher C and like all of that. So that's where, look at you, that's going to be the tough one.
I would like to see some specifics on, this COVID money that we have, and we're talking about getting some extra staff to help us with that. How? What does that look like specifically for families?
Like what resources?
No, if we're going to hire some people, great. And how's that going to work specifically?
Oh, like
What
do
are
they
the
get a check-in
logistics
for
of it?
10 minutes?
Yeah.
Do they get a, that
Yeah.
would be great if we could see something along those lines.
We will work to do that. We may, I'm just thinking through the reality of staff work. We will have something for the board, obviously, prior to Wednesday. We may not post that in the next 2 days, but we will absolutely have that in writing for the board prior to the 4th, so they understand what the impact is upon voting, just to give staff a couple more days to kind of like have the meeting with secondary principals on Friday and stuff like that.
And
No, but I know the board wants to understand if we, on what we're doing, how will that play out for families, so families have a clear expectation. And I absolutely understand the board wanting to know what that is, and I just wanted to say that we'll absolutely have that for you prior to next Wednesday, but we may not have it when we repost what this piece is by Thursday afternoon. So quarantining. Well, I heard a range, and I just want to check in. I heard a range, because I heard a range of saying we don't want to do anything more than we need to, which then that would mean there's no quarantining, because it's all optional. So it would be that if you have COVID, if you have symptoms, you're not excluded. Or did we not? I mean,
No,
so
no, no, I
what
think
wanna
if
do is
you
I
have
wanna
a-
understand that. No,
it-
that's why I'm bringing it
yeah,
up, saying, help
Sorry.
me understand.
Yeah.
When
I
we
think-
said nothing more than we
Sorry.
need to, where that landed or didn't, because there may be some things that, well, oh, yeah, this we are.
Yeah, okay. Good point of clarification. For me, to clarify, symptomatic, I think that's understandable. Just like if a child has a fever, a child has anything else for any other reason, you're home, tell symptoms. Oh, is that your question? How long are you home?
Well, I'm just saying, what I heard was a range of follow CDPH to we don't want to do anything we aren't required to do. And since our legal counsel says a quarantining guidance is all recommended, the extremes could be CDPH to nobody goes home for anything related to COVID at all. And I did not think that that was what was intended. So I was wanting to say, so is it, if you have symptoms or if you're positive, do you go home? Then we get into if you're vaccinated or unvaccinated, there are different guidance given. And then you get into exposure. So there's an exposure, there's a symptoms, and there's a you have it. And
so I think from a symptom standpoint, we talked about California Placer County Health having some recommended numbers. I know, and I've done the research before, there's a lot of things that are very similar to the others. So I think just from a point of clarification, a headache is a headache, but it's not, you're going home because you might have COVID and you go see your doctor. So maybe it's a multitude of symptoms, not just one. And again, not a doctor. So come up with some way of deciphering that. And I know, I hate to even put the school nurses and it's like, well, how do you feel? Well, and you get into that whole thing. So I think it has to be, to me, a few check marks, not just one. I think there's a list. And then I think it follows somewhat, and I think we had it pretty well. It was the 24 hours, make sure you're healthy and safe, or your symptoms improve. And then it's, you either go get a negative test or go see a doctor, or everything, whatever's going on with you, give yourself 10 days to get yourself all square. But that kind of comes back to, if I'm healthy, 10 days, I'm healthy in 5 days, or I'm healthy in 10 days. I think I would pull the 10 out, and I would just go with the simple of, when do you feel, you and your folks, when do you feel that everything's good, symptoms are past, you're ready to go back and be a good quality kid and learning, or you go get a test and you prove it that it's not that issue and it's something else, but if it's something else, it goes back to the other thing. Or you go speak to a doctor, which again aligns with go getting a test or go speaking with somebody of what's going on with you and getting you square. But I think that follows, I know I'm blah, 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 but that follows the standard, you know, are you hurt? Are you injured? Are you sick? What's going on? Let's get you healthy so that you can get back into learning. I don't see that much different than anything else that we would normally do.
So on point 3, I just want to clarify, you're suggesting they just have 2 of the ors. They have a negative test, or they go to their doctor and provide documentation.
And their doctor says they're good. And obviously, if you go see your doctor and the doctor says, "Hey, man, you need to stay out a little couple days," you know, work with your parents and your doctor and figure it
so
out.
you're suggesting take out the last or at least
So
10 days
the
of
only
test.
other thing that pushes, I'm walking through it. Oh, it's kind of a half on one page, half on another. So apologize. The only thing that, and I don't want to necessarily push, is if I don't get a test, spending money, and I don't go see my doctor, spending money, can I not come back to school? And I guess that's probably where the 10-day thing comes in. Like if I walk back, is that kind of the universal? The wherewithal to, you know, I mean.
You may have a population that chooses, hey, I don't want to go to the doctor, or I don't want to get a test. Well, what are we saying? When do they get to return?
And this
You know, I do think for me, symptomatic versus asymptomatic are 2 different cases. I think they're very 2 different. I think there is still valid heightened concern in our community of spread. I'm not asking we just go reckless and get rid of everything. I think for me, asymptomatic, I would like to propose we don't do any form of quarantining for asymptomatic students due to exposure. I think there's multiple reasons we've seen that. I have no problem discussing them if you are not in agreement with that. I feel like we might have a agreement there. I think the symptomatic one, I hear the parents that are saying, hey, we haven't been on campus in a year and a half. How are you going to keep my kids safe? I think it's fair right now to say, you know, if you have symptoms, and I would like them to be identified. I think you said there was 4. You know, I've heard of students. You know, I have a. Is it?
Yep.
Okay.
Yeah,
but I'm assuming it's like fever, like.
We would like to say to Placer Public Health, what are the symptoms, and you define them, because that way we have public health folks that have defined the symptoms, and I would prefer to ask them single or multiple. I'd like to have public health just determine that, and then they've already determined that if you have an underlying doctor's note that, you know, you're good.
I think just point of clarification, again, Placer County Health would be an excellent resource, is the one symptom or multiple symptoms? Just because, again, seeing it last year, I've heard the stories from different kids of, well, this kid was coughing in class and he got sent to the office and they said, we have a symptom, so you're COVID and you're gone.
Right.
And you can't get to your doctor for 3 days.
Would the board be comfortable with me asking Placer Public Health, what are the symptoms, and is it one or multiple? And we'll bring that back to you all.
And I think going back to what Timmy said.
There is guidance in here that says, if you go to your doctor and your doctor says, no, I know what this is, it's not COVID, you're fine.
We're meaning like, so say a student
So
didn't
that
drink
can't
water.
be described, can't
No, I'm saying though, like say they have a headache, right? And so somebody goes, oh, that's on the symptom list, so you need to go home, go ahead and get a doctor note. I'm gonna be honest, I'm a mom of a 16-year-old. My daughter's gonna get headaches for other reasons. And I would love to hear more clearly from Placer Public Health as to, hey, you know, is it every time a student has a headache, we're sending them home and then they have to go get clearance from their doctor? That it might take a couple days to get that clearance. What are your thoughts on that, Rick?
No, that makes sense. I mean, I will say, I think practically speaking, the chance of a child saying to their teacher and going to the nurse for a headache when it's not really a headache is very, very unlikely. If it's bad enough for them to say something, it's really hurting them, and they should go home and they should rest. And so I agree. It doesn't make sense to me if you just get a headache that you're then quarantined. I totally agree with that. That doesn't make sense, and I do want to understand that. Yeah, so in that one narrow thing, I totally agree with that.
So the way that we ended the year with scenario 1, which is symptoms, was they have to have a fever and other symptoms, which I think is
so
fair.
in that instance, that would not, okay.
So I think a fever with other symptoms is a pretty
what
clear
gives it
line,
away,
because we send kids home with a fever regardless. That's a
So that makes
no-brainer.
That's standard practice in daycare centers. That's standard practice. You need a clearance for at least 24 hours. I think then the question is, what if a family doesn't get clearance from a doctor? Do they then have to wait the 10 days? That is an extra layer of safety, but is that something we want there to be?
Well, I think, again, if we're staying with just the staying home when sick type of thing, if you have symptoms, then what we wrote here is you have the 3 pieces. 24 hours passed without fever reducing, other symptoms have improved, you know, and or they have the test or a doctor saying. So there are some pieces that could make it as quick as 24 hours that you could be back. Oh,
It says
okay.
and test, or, so that would need to say an or there if that's the case, right?
What we have to weigh that against, though, is you're potentially bringing kids back to school if you eliminate the 10 days who can get other kids sick. So you don't know. They could feel better, they're asymptomatic, and they come back and they give COVID to their class. So that's what we're talking
They're
about.
symptomatic in this case.
Yeah, or you're
No,
symptomatic.
she said we wanted to get rid of that. That was
Sorry.
the quick. Right now, as written, I think that's right. Where that doesn't work is as it's written, you'd have to get a test to show you are, and then I totally agree. And then you should come back, but you have to get a test to show.
So if you have a negative test is what we're saying, right?
And that makes
If you have a
sense. But
positive
the notion
test.
of leaving someone back in before we know.
Yeah. That's dangerous.
that's why the
I think there is a very felt concern out in the community that we have an obligation to those families to show, listen, we're not doing away with all COVID precautions. We are trying to legitimately keep kids healthy and safe and preventive. So the 10-day thing is there to ensure.
You don't want to test and you don't want to go to a doctor. 10 days to ensure you're not contagious.
Yeah, and that's from start of onset of symptoms. Or if you get a positive test. If you get a positive test, it's still a 10-day
That goes-
because we're letting it
Oh,
cycle.
if you get a positive test.
If you get a positive test. If you get a negative test, you're back as long as your symptoms are gone.
That's right.
I actually think that's very fair. I do. I want to make sure, I don't want to leave tonight with a portion of our community going, you guys are being reckless, you're putting our kids in danger. And I think that's a fair way to keep kids safe. I think that's shown it could take a few days and symptoms, I'm better magically tomorrow. It takes a few days with
Tests
kids.
are widely available and usually a 24-hour turnaround now, so it should be, and it's free.
Right, and so it sounds like we have some agreement on that piece. Then we get into, if you have COVID. So now you have COVID. Is there any says that the same? So we're good there. So now we get into exposure, which has multiple categories. And I'm sorry to go through, I just want to make sure that, so when we get to next week, there's areas that we've already, have some clarity on, it'll make it
Well,
clear.
I think, just
Wait,
a reminder that
I'm sorry. Where are you now?
we're on, yes.
To me, we're on the whole close contact thing.
Okay.
Yeah,
Just to
me, it's not.
reiterate what Rick said, because I think this is where they were thoughtful in the guidance, is when you wear a mask, when you follow the requirement, there is no quarantine. It doesn't, if you're not symptomatic, you don't quarantine. So if you're exposed, if a kid in your class is positive and you're wearing masks, then nobody goes home. You all stay there.
That's your quote-unquote insurance policy.
I still think, though, that the guidance isn't.
It's not required, it's recommended.
And so I would still like to see that the exposures, quarantining due to exposure, I do not think is necessary because it hasn't been made necessary to us by either a state public health order or a Placer County public health public order. Now, if Placer County Public Health puts out a directive like some other counties have, of course, I think we reconvene and we rediscuss it. But the fact that they haven't regarding that, I will say that I think exposures, quarantine due to exposure, whether masked or not, that is not our place to be making that decision.
Are we in agreement about that, or do we need to put that on a vote for August 4th?
We're not.
Okay,
So
that's
again-
fine. I'm just throwing it out. Maybe we need to move it to a
we
vote.
what I'll say we have clear recommendations from medical experts, and we are saying we disagree with the medical experts. And I don't know how we can sit here and go through this and say, no, we want to do that. We don't, I don't know what. I
Yeah.
get it's
It's
not
a
required, but I'm not a doctor. So you're
Then we
actually
talk about it next
making,
week. Yeah.
you're making me decide whether I think asymptomatic can spread the disease or not.
Right.
And I'm not going to make that decision. I'm not. I have no authority to make a decision like that. It's been made by public experts, given to me as a recommendation. I'm going to follow the doctor's recommendation.
Roger, can we just move that to next week for a
Yeah,
vote?
so just based on this, what I will prepare in the document is, as we have it stated, and then I will prepare another piece that says, no students would be quarantined based on exposure. And that's, I've heard those
Asymptomatic.
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 So, and just so in that scenario, we do know as a fact asymptomatic can spread the disease. In that scenario, you could be a close contact, let's be very clear. You've been 15 minutes or more next to someone in a close contact with no mask, both of you. So it's not randomly. You spend a lot of time with someone we know is COVID. So you then go, and then you're brought right back into school. We know that there's a reasonable chance you got the disease, and we're saying, we're good. Come on back.
Okay.
You don't have to take a test. You don't have to prove anything. Come on back.
Hang on, one with off the point. It says both parties were wearing a mask, so are we expecting the exposed E, the one who has
They
the
both have
positivity?
to. If either one's not wearing it, then it's out. That's the way that's
Yeah,
written.
what I'm saying is if I am exposed and I have it, I sit next to Julie in math, but Julie wears a mask, is that
Not
to get out of
according to
jail
this.
free?
Not according to this.
That's what I'm trying to figure out, that both piece.
Because they're assuming that everyone's wearing a mask. So that's,
Yeah,
but yeah, that's right.
I don't agree with that, but I just think if you're gonna, if we're saying before, wear the mask and you're okay, but we both have, or like she has a mask on and I don't, and I'm positive, I still think at that point, the mask is the insurance policy that lets her get out and go about her day and do her thing without having to take 10 days and having to pull
I get
people
that,
out.
but I go
And
back to
that's where-
again, based on what? How do you know that? The medical experts say you're wrong. You may be right. I don't know, but how do you make that? How do you make that determination to say I'm good with that based on what?
I don't think
That's
that's
why I'm
fair.
like-
The medical, they could have said required, and they
I
chose
understand they
not
could
to.
have, but they did give clear recommendations.
And I hear you on that. And so I think when there's a recommendation, that's up for local decisions to be made, and we do that by putting it to a vote. And
No,
so I
for
think
sure.
we look at it
That I
right,
get.
and we just
Right,
say, hey, what are our options here? Recommendations are options.
Yeah.
It is very much, well, I guess everything's an
I
option, but
appreciate
no
that,
one.
but I still stand
no,
by my question.
and-
How do you know?
And that's,
how do we
that's
know?
good. But I think we could go round and round tonight. That's really the purpose of a public forum when we're taking a vote, right? Tonight was more just to give, hey, guidance for what we are planning to discuss on the 4th. And so I think there's
No,
lots
tonight's
of.
actually to give Rogers clear guidance to give us guidance.
Yeah,
So
and
it
I
does
think,
have impact. It's
I
not-
think
we're not just
each of
planning.
us have shared with him,
For sure.
though, where we stand on the quarantine, and I don't want it to feel tonight like we're going back and forth of, well, look at how many people we quarantined, and none of them actually came back with a positive test, so why did we do that? I think some of that is when there's a recommendation, we're just saying we would like the opportunity to take it to a vote on the 4th as to.
No, I understand that, but I still would like to use the opportunity to talk about it. So I do get back, that's where Derek, that's where I'm stuck, is this notion that it just doesn't feel right to me to make medical decisions like that, to say, that's okay. And so that's why I defer.
We will write this as two options for the board. Thank you.
Yeah, no, and I think we were,
Go on page 3.
so that, I guess with the multiple decisions, I guess there's, the whole quarantine piece goes down the path of, am I vaccinated, yes or no? Do I have a mask on, yes or no? And then that's what I'm trying to figure out.
I mean, from what I heard
Because
from
I can see like
this-
4 options here.
Yeah,
That's what I want to try to manage.
from what I took from this was, option A is written. Option B would be anybody exposed and is a close contact that's asymptomatic. We don't care if you're vaccinated. We don't care if you had a face covering. It's just like if you're asymptomatic and you were exposed as a close contact, no quarantining. That's what I heard. There would be no distinction between face coverings, vaccinated, non-vaccinated. It's no symptoms. There's no quarantining for close contacts.
I think if that was on the table, I think it should also be notifications, though. I think parents should have a right to decide if they want to keep their kid home or quarantine their kid or test their kid.
We feel a due diligence we feel an obligation to inform any parent of a child or an employee that they were exposed. And what we would end up saying if the board adopted this is your child's been exposed, we recommend you go get them tested.
I think what I heard Julie say is something a little bit different, and correct me if I'm wrong, but even if you're not, I do agree, which is that's what we said last year, What we're saying this year is, when I got letters like that, what was clear to me is because it was said, your child was not exposed, but what I did know is everyone who was out on quarantine. Now, this year, if that happens, that's not the case. And so the question is, will parents be told someone was exposed and they're still in the classroom? And so you need to know that. And then you need to make a decision on what's best for your child, because you're choosing then to send your child to a thing where we know someone's been exposed and is risky.
Your child is exposed, but the sick child is gone, right?
But we know asymptomatic can carry it.
For
We
sure,
do know
for
that.
sure. Okay, I just want to
So you're-
clarify on the email
Right,
that
so
comes
shouldn't
home.
parents get to know that? If you were
They will
literally-
know it because we're going to vote. And so whatever we decide.
They wouldn't. They'd know our policy. They wouldn't know if a child in their classroom was exposed and chose to keep coming.
Which almost makes me want to say if a child is symptomatic and they test positive, it should be a whole school notification. Just a child on our campus was symptomatic or tested positive
Which
for
happens.
COVID.
That's what happened last year.
We had that
We got an email every
Right.
time.
Right, I mean,
Right.
and we absolutely would want to do that kind of piece. The question I heard was, are you going to include in there saying, and students are not being required to quarantine?
You don't think parents have the right to know that?
Because that's what I heard.
I don't think
Rick
it's
phrase it.
a matter of right, Rick. I think I'm thinking the practicality of that. So say there's a student here that's tested positive or that's tested positive. And so within the 6 feet, all of these people, they're notified. But then to say of those 15 people, 4 decided to stay home, this many decided to stay here, I'm not understanding, A, how we would accomplish that, and B,
Because I think there's a lot of parents who would be very concerned, knowing there's spread of asymptomatic, if we're choosing to go into a place where it's not just random. There's a very legitimate chance they have it. It's no guarantee, but there's a higher chance than if that person wasn't exposed. I know that, and I know that they may choose not to wear masks or whatever. And so, then as a parent, my risk is much higher sending my child into that classroom than it was before we knew there was. And the notion that we would know that. We would know your risk has gone serious, and we are not going to tell you. I don't see how that's parents' rights.
oh, sorry, I'm not saying not tell you. I'm confused what you're saying.
I'm asking that we tell the parent.
Tell the parent what?
That-
I think we're all
there is-
saying.
There is a asymptomatic student who's been exposed in your classroom for the next week.
Do you not think that's the case all the time?
No, we did not that we
Around
not that,
Costco, and people could be asymptomatic.
I'm sure it is, but I don't know it. Here, I know it. Here, the Rocklin Unified School District knows it. It's a fact.
But we
and-
don't know they're asymptomatic. We know they've been exposed.
So in that case, we
No,
would.
we know they're because if they're symptomatic, they're gone. So we know they're asymptomatic.
No, because they could just be healthy and they didn't get it.
But that's asymptomatic.
Okay.
So, wait,
No,
I'm
they
sorry.
could have it and be asymptomatic.
not
That
showing
means they don't have symptoms. Right.
No, it doesn't. It just means you're not showing symptoms. I guess it could. Fair enough. I think it is fair enough. It's implied. So the point being, we don't know, but we do. What I will say is that the risk level for me as a parent just increased. If I know there's been exposure in that classroom, and I know the person exposed continues to go, and maybe chooses not to wear that says, and so it feels to me, if you know that, the Rocklin Unified School District, and my classroom knows that, but you're not going to tell me the parent, I'm not sure how that's parent empowerment. I just don't understand how that makes sense.
Okay, I hear you. So how do we actually do that though? So like say 15 kids were exposed in one classroom. We ask all them, do any of you plan to come back tomorrow? Like I'm legitimately trying to figure out how would we
Right.
do that?
Right? If that were where we end up, where we say we're not going to quarantine you, then we say, yeah, and are you going to come back tomorrow? Yes, I think we ask.
Well,
Or I don't know. I don't know how we do it. I actually don't know how we do it. But I do know
just
that I
hearing
feel
the conversation, I think if the intent
But again,
was
I
we
think
could
this is where it
say
gets tricky. If we
that
just
this was occurred and we advise your child to get tested because this occurred and students are not being. I mean, you just say students are not being required to quarantine. We advise you to get your child tested. So we just say that because the mechanism of having that occur is unworkable for us, and then it right, and because they could at any point. So I think we'd have to just say your child was in a classroom with a person opposed. We recommend you get tested. Right, and students are not being quarantined. So we just state that because that's piece, because I think that gets in the piece of parents don't say, well, last year when I got the letters, I knew this to be true, but this year you didn't. I think we are just clear. We're clear because I think that's where we wouldn't want to have a parent say, but you didn't tell me. Well, we tell you, and then you can make your best choice, because you may choose then to have your child stay home because others aren't, even though they weren't. And so we can work through that. We will think about in the next couple days, is it the whole class? So we just blanket versus we do the contact tracing, piece. So we'll think through that a little bit more, so we can work through that. But because in elementary it was whole class, secondary we did that. So we'll think through this. School-wide, that gets into where I don't know that it would be helpful, because in a high school, I may never encounter that child.
You wouldn't tell the whole class.
No, I think that we would. I just want to think through, because in elementary we did that. And then secondary we just did the U in the 6-foot range. We may just opt for the whole class.
That only makes sense if you stay in that 6-foot range.
Yeah.
If you have guaranteed and you don't walk around the classroom, which is not true. So I think you would need to tell the whole
And
classroom.
it may be easier for us actually to just do it that way, because we say period 3 gets the letter. And no.
And I think that's an extra
you may get
level
more-
of due diligence for parents, especially if there are masking concerns or issues. I agree with that. I think going to the whole class is necessary, so parents know there's maybe more of a possibility my student could have been exposed. I think that's fair.
I think that's just a due diligence of informing. It's, again, I don't want to equate this to lice, but it's an example. When a student has lice in a classroom, we send a letter saying, child had this, we advise you do X, Y, Z, and here's how to look for it. And then we do it, we handle it that way. So we have a practice of due diligence of informing, and I think this falls in that. And
Especially for sharing manipulatives and stuff.
or just the other, and I hate to bring it up, but the only other piece that there was some discussion, and just so is, we made a recommendation on visitors, volunteers, that we would not do a check on vaccination, but we would require masks, because an adult coming into the setting, the school setting.
Yeah, so I think this is where it gets really funky with, I'm at a volleyball game and we're bringing parents and kids in the same room, but I'm in a gym. Are we gonna say mask, yes or no? Are we gonna have them self-attest versus I'm coming in to support my daughter's second grade teacher, and I'm just gonna roll up to Sunset Ranch and help out. So I don't know if we ask all the same questions the same way. I know I'm sure we have a volunteer protocol as far as going into the schools. I don't know if that's where we would potentially self-attest or just allow them the opportunity to do that,
Yeah, I mean, if the board said,
It's
hey,
real-
we would prefer a self-attestation option for volunteers, so that, they have an option, we could look at that. We had heard a lot of concern around asking anybody about vaccination status in the form at all.
Yeah, I don't
So
wanna go down
that's where we
PHI.
thought, well, if we're not gonna ask about anything around vaccination, then we default to the face covering, because these are folks coming into your child's room, you have no idea they're there, and so.
I think it makes complete sense for volunteers to wear a face covering. Teachers, office staff, kids, everybody on campus is going to be required to wear a mask, so why wouldn't volunteers wear a mask?
I mean, the guidance says K-12 school settings, all adults. It doesn't say staff. It
Yeah.
says all adults wear masks. So in that setting, you would have to.
In this
even a
case,
gym,
we aren't
same thing.
treating unvaccinated different in any way under this.
Just wear a mask.
And so I mean, that was the kind of the goal of working towards that, and also ease of implementation, frankly.
I do think there's a difference between somebody volunteering in a child's classroom and a volleyball game or a basketball game. I do. I think they're two different scenarios, and I know we want, ease here, but I know, our attorney even gave us, visitors. Many other school districts are utilizing self-attestation approach for visitors. It doesn't really clarify. I don't see anywhere on here a discernment of visitors versus volunteers in the classroom. So I guess I don't know what that means. Like, it says on here that it's not saying that they're actually asking people walking in. It's just saying that this means that anywhere a visitor may enter, such as on the doors and windows when entering school sites, district admin buildings, surrounding the board meetings, et cetera, the district should post signs indicating the following: face coverings are required, So I guess for me, self-attestation means two different things.
Well, I mean, the attestation is around vaccination status, and the idea being that if you're vaccinated, you don't need to wear a face covering. However, when students are present, that's where CDPH, so that applies to adult-only settings, if you will, in schools. When children are present, that attestation doesn't work. It's you need to wear a face covering. And so that's where a lot of the conversations boards had around students, but when about the adult piece, that, you know, was set there. So the board could say, well, you know, for volunteering and being, you know, on that we're gonna have this, but if you're going to attend a volleyball game, we're gonna do this other. But the CDPH was clear in their guidance that if adults are around kids, you gotta wear a face covering. And vaccination status doesn't exempt you from it. It just does when you're around other adults. So, you know, you could bifurcate it if you wanted to around volunteers and just being on campus at an event, but that gets into where the kids are present kind of thing.
So, because the A to B option on mass, that's for students. We are still saying teachers, adults are still fully masked at all times because that is what's required. That's what we're hearing, right?
And it's in CalOSHA as well. So
Okay.
beyond the CDPH, there's a CalOSHA as an employer requirement, and so working to, you know, follow that as well. Again, they have the opportunity to attest to that, so when they're in adult-only settings, they aren't required to, but when they're around children.
I guess my thought is, so if a parent walks in or somebody walks in, a community member to a volleyball game, they're not allowed into the building unless they have a mask on?
If that's how the guidance would read, yes, because children are there.
Unless the athletic guidance comes out differently, that's how I would read it.
Right, yeah. Let me take a look at that.
You know what I mean? Like, then what
Yeah,
would
I
we
know.
talk about?
Which one?
This one, he's the one we sent today. Like right here. The district is not required to document visitor vaccination status.
Outdoor event, you're good.
No mask.
No mask.
Yeah, go for it.
Yeah. Here's what we're looking at, though, why we were confused, because from our legal guidance right here, the one we got today was, the district is not required to document visitors' vaccination status. There are 3 options for visitors in situations where masks are not required. 1, provide information to all patrons, guests, and attendees regarding vaccination requirements and allow vaccinated individuals to self-attest that they are in compliance prior to entry. 2, require proof of vaccination, or 3, require all patrons to wear masks. So,
So I heard
I
you
think,
read the
I think it argues you're doing what the guidance says, and therefore, so it's when masks are not required, which is outdoors. It assumes you're following the law.
But when masks are not required is like the district office, because we don't have students present, but we're required to have them in school settings with children.
but I think that's at school settings, so all of our games are, I understand the volunteer in the classroom. Honestly, I'm excited to get volunteers back in the classroom. If they need to wear a mask, listen, I wanna compromise here. I'm more sticking on, I'm just trying to, because it says on here, outdoors at schools are optional, so why would he even put that down there? That's why I'm just confused.
Yeah, when I look at, like, I guess I go back up to the single, now I'm re-looking at this again. When I go back up to the double asterisk that you just read, it was kind of like, where is it at? So, yeah, fully vaccinated employers and visitors. So I can clarify with legal counsel of, is there an option for self-attestation? to attend an event at school, games, back to school night, you pick it. I think I've heard on volunteers that because they're working with kids that we would just say it's this, but for this, I'll seek clarification, and then if there's a way to write it different, we'll do that, but we'll seek on that. That's helpful. Dr. McDonald, since I know you're going to help me write, we talked at the break. Is there any other area you feel we need clarification? I know I think I've got mine, but I also want to give my colleague a chance to ask.
Got the big 3, I think.
Okay.
Quarantine, volunteers, and masks.
Just so we can come back.
Don't hate me. Yeah, there's one more, no, there is one piece though about, so a student plays volleyball. It's indoors. If we choose A or B, does that change them wearing a mask while they're playing? I have to ask it because, okay, so a student, because they're in different boxes. The student is playing a volleyball athlete, an indoor sport, okay, basketball, volleyball athlete. If we choose the B option, how does that affect an athlete? Right? I'm just,
I think we saw this with basketball, definitely, and some of the other indoor sports, where on the bench, kids they would be separated and they would wear the mask, but in the game, it's not logical. So this is where, this was the practice we did last year. I could see going down the path, or do you just say, hey, as an athlete, you manage your athletic self?
Well, we don't have any answers on if we have to still test water polo, football, and our sports. We have no indication if there will be face covering guidance included in the athletic guidance. So for practical purposes, what we would take is apply to athletics what you apply to schools. Because we aren't saying we're going to treat drama or ROTC or athletics or in a classroom any different as far as that regards. You're indoor, you're outdoor. That's kind of our demarcation line, unless we get specific guidance or the board wants to start going down that road. Because for us, it was just kind of either indoor, outdoor versus have situational makes it different.
I think sports are different than a classroom setting for 6.5 hours. I don't know. I throw that out there.
I will say that many of our athletic coaches made adjustments to try to keep kids as safe as possible. For example, at the volleyball game, like President Counter was saying, spread them out on the bench. They did wear a mask when not in the game. For example, in volleyball, if you've never been to one, every time they score a point, they come together and they do a cheer. They stop doing things like that.
They don't wear a mask in the game.
Correct.
There's no mask wearing while they're physically playing.
Now, in how they rationalized it was, because you're doing regular testing, we'll know if you are COVID positive. So because you've done regular testing, indoor sports, football, water polo, high contact, we then feel comfortable to say you don't need to wear a face covering. So my wondering is if they're going to continue to allow that, will they then require the testing? Because that's how they felt it was safe to do it. Because theoretically, anybody not wearing a mask or in close contact, think of wrestlers, you knew what didn't have COVID. So that's where that
But again, the difference now, right, is we have an adult population that can be vaccinated, right? And so it kind of, to me, falls into that asymptomatic. We're treating healthy kids as though they're sick.
Or we could even get guidance that says, okay, high school athletics, you're all eligible to be vaccinated. If you're vaccinated and you prove it, then you don't have to get tested. But if you don't, then you get tested. And I could see that occur because the idea you can't play the game with a mask on. We want to make sure that anybody that gets to do that is safe. And there's two ways. You get vaccinated and prove it, or then if you don't, you get tested. And the more we think about this, we could see something, end up like that, which...
They did make kids, when my kids are club volleyball, they wore masks all summer in their teammates while they played.
Well, I'm not a fan of vaccinated versus unvaccinated differences, but it sounds like on that one, we're awaiting guidance, new updated guidance that we expect before our season start. Okay. I got them both and the toes.
Right, which is where we've said until we get, that's where we've been told, until we get new, we follow the old, and we're working through that. And that applied to competitions. So we're working through that. We have practices and all kinds of things occurring. And students that have been in club sports, which many of our kids have been operating, and so that is moving. We're waiting the guidance, but we'll seek clarification on attendance at these events. And if we self-attestation.
And by self, not, meaning a signs on the door, not, we're actually asking all attendees to physically
Oh, I mean,
attest anything.
we would say, you know, if a test could be as simple as, here's a QR code, scan it, you just log in and say, yeah, I'm good. We don't ask you to prove anything. That's a self-attestation. It could be that simple, that we just say to folks, please do that, and if you don't, wear a face covering. Then you can get into the whole, is it like if you want to go to Hawaii, you need to show your QR code of the thing before you get in, or is it just we ask you to do that and we assume you did it, and if not, you're wearing a face covering? I mean, it could be a range of that as well.
Yeah, when you get the legal counsel response, if you could ask them specifically, because they do say one of the options is to self-attest by providing signage on the door. Meaning an attendee attending like a volleyball game.
Right.
That they don't have to have a QR code, but
Kind of like
that,
how businesses are operating.
like how businesses are operating.
yeah.
That I would like to see that as an option for games, community events.
Yeah, no, absolutely. And again, we'll push on the indoor students present, because that seems to be the point where it changes. Okay. I feel we have enough information to complete
One
our
more.
task.
It's not a question. I do want to say, I do think there's an opportunity for lack of clarification. Well, so there are multiple places throughout this document where masking shows up. And as, again, the confusion to me was we said, here's a choice in the first box, we never said it again. So we talk about you have to wear a mask in offices, quarantine return, depending on whether we see with quarantine, visitors have it, athletics have it, performing arts have it, transportation have it. I just want to make sure whatever you provide is really clear on all of those, that we don't assume anything. We don't assume if we say B that it goes throughout or it doesn't go throughout. We want to make it really clear what we're saying across all of those areas. Does that make sense?
So you're saying, based on whether you choose A or B, you
What
want it
could
to
happen
be
is you could say,
reflected in all
we
the
chose
guidance.
B, we choose B. And then we say, well, we always assume transportation, that you have to wear a mask on the bus. I don't want to assume that. I want to have that clear. I want that clear, that that's the recommendation is, it goes, or whatever it is. Or we say everything is A or B, except for parent volunteers, no matter what, you're going to wear, whatever it is, be clear on what we're recommending.
I think that goes back to what we were saying before is, if it's not identified in here, we assume, you know, a 2070, no, I'm with you.
Everywhere there's masks, it's going to be A or B, or say it different if it's different.
Yeah, I interpreted it that the A and B was only for the students, K through 12 students in this box.
Right.
Oh,
yeah,
it says staff?
Yeah, we will further break that out, but our recommendation was that in those other settings, transportation, those that students are masked. But we could put an option A, B in each one of those and okay. Okay. Right. Right, so we could put no option to not I mean, we could just state it explicit in
We could always come on the 4th, though, and it doesn't have to be exactly options A or B. You could always come and say, hey, looking at this, I've thought about it more, I've talked to more. I know, Julie, you said you wanted to talk to some people. Hey, I would like to propose this, da-da-da-da-da. You could always make a motion that's not one of the options on the paper.
Oh,
But actually, what I'm saying is whatever we pass that is on paper is what is true. And if it says, if we pass the transportation as written, then we're passing the transportation. We're not going to go back to, well, we should be here, so therefore it's like we're clear, this is what we're agreeing to.
Right, and what I would, and that's why we want to try to be as clear in how we construct the document for the board, so we can make your conversation and decisions as efficient as possible, because we, in looking at the agenda that I'll be sending to President Counter, requesting his approval, it's a packed night on other stuff, just because it's start of school. So we'll do everything we can to help make your deliberations as efficient as possible, so that we can do that. This has been very helpful, and I think, you all having a chance to hear each other's thinking and wonderings, over the last 6-7 hours. But I mean, this is I think, as one of our speakers said, this is, your diligence has been impressive, and I think, the good news is we're not starting from scratch next Wednesday. We've covered a lot of ground, and that hopefully will be helpful. And I think that's where the more we can have it written in there and the less are being created on the dais, the more efficient that will hopefully make the meetings. That's why airing this out helps us.
All right. The July 27, 2021 RUSD Board Study Session is now adjourned.